Ladies and gentlemen, distinguished delegates, on this very special occasion, please allow me to extend our warmest greetings to all of the speakers and also our honorable participants. It's a really pleasure for me to welcome you at the International Conference Achieving SDG-10 Post Covid-19 Pandemic, and also the book launch, Implication of COVID-19 in Economic Inequality in Asia. My name is Yamita Bunga from Padjajaran University, and I will be your master of ceremony on today's event. Once again, I would like to give you a best welcome and greet to the Honorable Senior Policy Advisor from Bappenas or Indonesian Ministry of National Development Planning, Dr. Vivi Yulaswati MSc, who is joining with us via online. The Honorable Director of SDG Center University of Padjajaran, Professor Dr. Zuziana SSI, MSI. The Honorable Asia Regional Advocacy and Campaign Lead from Oxfam International, Mr. Mustafa Talfur. And the Honorable all of invited speakers, chair and discussion from diverse institution, and not to forget the honorable guest from the ministry, government institution, non-government institution, academician, and of course, our lovely participants. All right, before we start our event, allow me to share you the house rules of today's conference, which can also be seen on the screen above.
Sadar bahwa penyandang disabilitas itu satu, tidak semua memiliki latar belakang pendidikan.
Yeah, the house rule. First is the SDG Center of Padjajaran University as the committee of the event has a commitment to protect the health, safety, and safeguardings of its participants, volunteers, and other people who could be affected directly by the arrangement of today's conference. And next is all participants in this conference shall observe the house rules and any other applicable local laws, rules, regulation, and condition, including but not limited to any internal regulation imposed by the committee. Next, all of the conference participants are responsible for assessing and controlling the health and safety risk before and during the conference. The committee ensures that effective control measures, safe system of work, and suitable emergency arrangement are in place before the event commences. And next is all the conference participants shall not breach of safeguarding policies, sexual misconduct, sexual abuse, and sexual exploitation policies. And the last is report immediately by phone or in person and lapses in security harassment, suspicious incident or action in around the conference venue to RESTU from SDGs Committee on 0813 2046 2146 or our duty manager at Ashley Hotel to Abi Fardi on 0815 119 1940. And ladies and gentlemen, please always be reminded of these rules, as safeguarding is not only the community responsibility or the participant responsibility, but it's also everyone's responsibility. Okay, so ladies and gentlemen, before we move further to the next session, I would like to invite each and every one of you to stand up and give our utmost respect to the Indonesian national anthem, Indonesia Raya. please have a seat. Ladies and gentlemen, I would like to also inform you that this conference is being relayed on Zoom and also live from YouTube SDG Center. All right, to kick off today's conference, ladies and gentlemen, first of all, I would like to invite the Director of SDG Center University of Padjajaran to come up to the stage and share the objective of today's conference. Let's give a round of applause to the Honorable Professor Dr. Zuziana, SSI MSI. To Professor Zuzi, the stage is yours.
Assalamualaikum warahmatullahi wabarakatuh. Can you hear me? Okay. Excellencies, distinguished guests, ladies and gentlemen, please welcome to the Asia Regional Conference on Achieving SDG-10 Post Covid-19 Pandemic and a book launch, Implication of COVID-19 on Economic Inequality in Asia. First, let me use this opportunity to specifically welcome Ibu Vivi Yulaswati, the head of SDGs National Secretary, Ministry of National Development Planning, Bappenas, and then Pak Yanuar Nugroho, expert coordinator of SDGs National Secretariat, Pak Elan Satriawan, Chief of Policy Team TNP 2K, and Pak Purna Gunawan, Head of Policy Team for Economic Capacity Building, TNP 2K, and Pak Setio Budayantoro, Manager of Economic Development Planning at the National Secretariat, and then the representative of Ministry of Finance, coordinating Ministry for Economic Affairs. I would like also to thank keynote speakers, Professor Andy Summer and Dr. Eduardo Ortiz from King College, London, and also other distinguished speakers, discussants, and chairs that I cannot name one by one. On behalf of SDG Center Universitas Padjajaran, again, welcome to this conference. SDG Center Unpad hold this event. It's our privilege and pleasure to have this opportunity to host the seminar and book launch. For your information, SDG Center Unpad is the first SDG Center in Indonesia, established in 2016. This is the first year of implementation of global SDGs, and probably SDG Center Unpad is also the first SDG Center in Asia. SDG Center Universitas Padjajaran seeks to play a strategic role in helping Indonesia achieve SDGs in 2030. And SDG Center of Universitas Padjajaran is a venue of multidisciplinary research related to SDGs at the global, national, and local scale. It serves to facilitate sharing of SDGs-related research findings from both the university and its partners. It also facilitates capacity building to enhance the analytical capacity of the academic community and policymakers from the national and local levels to conduct SDGs-related analysis. Our vision is for Indonesia to achieve SDGs in 2030, and our mission is to provide evidence-based policy recommendations to achieve SDGs. Independently monitor the progress of SDGs and then mainstream SDGs into research and policies, and facilitate dialogues to achieve SDGs. Our main activities include independent studies, applications, training, research collaboration, networking and facilitation, and conference, workshop, and seminars. We engage in SDGs knowledge, innovations, and solutions. SDG Center Unpad has produced publications such as books, papers, journals, op-ed, and opinions, popular media articles, and etc. And we also develop a partnership with many institutions, COVID-19 pandemic has shown to have disproportionate impact to the poorest population in almost all countries in the world. We observe inequality, especially within countries, has been increasing. Thanks to the pandemic, its aftermath, and now a new global economic crisis. We at the SDG Center always believe that tackling inequality is the heart of the SDGs agenda. SDGs is basically our collective global effort to achieve both intragenerational and intergenerational equality. COVID-19 in particular have put us behind schedule on so many socially progressive agenda, setback and even regress in various social aspects of development caused by the pandemic need to be addressed much more in non-business as usual manner. This conference will discuss this important issue and will be based on a book published by prominent social scientists across Asian regions. G20 presidency in the year 2022 is with Indonesia. The 17th G20 Head a State and Government Summit will take place in 2022 on 15 to 16 November in Bali with the theme of recovering together, recover stronger. The world needs global solidarity and cooperation and joins the action to tackle challenges such as inequality, climate change, and the impact of the pandemic. Therefore, this conference has been scheduled a week before G20 Leaders Summit to draw the attention of the world leaders and submit post-policy options to tackling inequality. The conference aimed to deliberate upon the following. The first is what are the implications of COVID-19 on already high levels of economic and gender inequality in the region, and what pathway lead to the increase and decrease of inequality. Second, which public policy measures have been introduced during the pandemic response? Were those measures adequate and have they worked? The third, what structural and systemic changes are required to tackle the region's staggering levels of inequality and shared prosperity? And fourth, what needs to be done to accelerate progress on SDG-10? And finally, what is the key lesson from the pandemic response? And important regional event brings academics and then public policy official, political leaders, think tanks, multilateral and bilateral donors, and media and civil political leaders. From Korea, Malaysia, India, Pakistan, Bangladesh, Indonesia, and the Philippines. We invite 70 participants online and 100 online. And the expected outcomes of this conference are that participants understand the effect of the COVID-19 on the region's high economic and gender inequality levels, and the factors that could cause this level to rise and fall. The participants know which public policy measures were implemented during the pandemic response and whether those measures work. And participants understand what structural and systemic reforms are necessary to address the alarming levels of inequality in the region and spread prosperity, what should be done to quicken the SDG-10 process, and what we can learn from the pandemic response. We do hope that we can come out with good recommendation and what exact steps to be taken to address the risk of rising inequality that is exacerbated by the multiple crises that we had experienced since 2020. Thank you. Enjoy the conference, and especially for those coming from abroad, spend time to enjoy Jakarta. Thank you very much. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Professor Zuzi, for the very warmest welcoming speech. You may have to return to your seat. Distinguished guests and lovely participants, next I would like to invite Dr. Vivi Yulaswati, MSc. She is a senior policy advisor from Bappenas, Indonesian Ministry of National Development Planning, to share her opening remarks with us, as well as to officially launch the implication of COVID-19 on economic inequality in Asia's book, which we've been waiting for. Am I right? Okay, so without further ado, Let's give a round of applause to Dr. Vivi Yulaswati MSc, to the Honorable Dr. Vivi, who's joining with us via online. The time is yours.
Thank you, Ms. MC. Excellencies, Professor Susiana, the Director for UNPAD SDG Center, distinguished speakers, panelists, ladies and gentlemen, very good morning. Assalamualaikum warahmatullahi wabarakatuh. Shalom, salam sejahtera, Om Swastiastu, Namo Buddhaya, salam kebajikan. First and foremost, let us give thanks to the Almighty God for allowing us to gather at this international conference on achieving SDG-10 Post Covid-19 Pandemic, and a book launch about implications of COVID-19 on inequality in Asia. Highly appreciated to the UNPAD SDG Center and other related partners who held this important event, and a warm welcome to all of you who are able to participate offline as well as online. Dear distinguished ladies and gentlemen, Indonesia has set a vision of becoming a developed country with a high income by 2045, with the goals of rank 5th in the world as the country with the largest economy. We are required in this regard to prepare human resources with higher quality and productivity, accelerate the achievement of sustainable development goals, as well as continue our transformations toward the green economy. Achieving this lofty vision will not be an easy task. COVID-19 pandemic has disrupted the progress of many of our development targets. The lockdown, restricted mobilization, as well as physical distancing have affected at least 31.8% of businesses which stopped their operations, according to the survey on business owners by Statistics Indonesia in 2021. The number of informal workers also rose to 60.5%, in which this marked a shift in the labor market, with around 5.72 million of workers moved from the formal working arrangement to the informal ones. Before pandemic, actually we had suppressed the number of informal workers by almost 2 percentage points from 2015 to 2019. Furthermore, the economic shocks from the pandemic also put women workers in more vulnerable positions to maintain their performance in the work from home setting, as well as to manage the heavier burden of the domestic works. Achieving the SDGs on time would help us achieving Indonesia 2045 vision. SDGs evaluations on 2021 data showed that around 56% of Indonesia SDGs targets are on track. The national poverty rate, the prevalence of stunting and wasting of children under age of 5 continues to decline. The post-pandemic economic recovery efforts are evidenced by the rise in the manufacturing sector's GDP growth rate and the decline in unemployment. At least 2,000 companies participated in the corporate performance rating programs valuations, which had contributed to the reductions of pollutant by 46 million tons, along the line with the reduction of the greenhouse gas emissions and the expansion of the area of marine conservations. The pandemic has also increased the internet users to 77.2% in 2021, although the digital gap and literacy challenges remains. Distinguished ladies and gentlemen, research helps us to understand the key factors that drive inequality in Indonesia. From the previous studies, we learned that there are inequality of opportunity, a high degree of wealth concentration by the few, low resilience to any shocks, and vulnerability to fall into poverty. And we will hear more today about inequality through labor markets. The recent post-COVID studies have begun to emphasize the importance of pursuing inclusive development. A study from the World Bank showed that a 1% reduction in the Gini ratio could obtain from inclusive development has a far more significant impact on poverty reductions than 1% economic growth. Other study by Zaman et al. Regarding the progress of the SDGs achievement in Asia showed that in general, the presence of the COVID-19 pandemic will result in a decline in SDGs achievements by up to 2 to 3% lower than they should be. This is equivalent to a delay of about 1.6 years in achieving the SDGs in the Asian regions, which should have been achieved in 2030. Nevertheless, the political challenges of being able to implement inequality, reducing, then growth enhancing policy in practice are quite complex. Pursuing only high and extreme economic growth would likely to exacerbate the existing inequality. As the proverbs say, to kill two birds with one stone, solving the inequality problem will lead us to meet the SDGs by 2030. Tackling inequality may lead to reaching other SDGs as well because of its interlinkages to other SDGs. Rearranging development indicators to the right trajectory is not also easy, especially in terms of inequality. We need to make extraordinary effort to improve current policies, including in social protection investment, promote decent job creation and equal pay, eliminate discrimination and all types of inclusive-oriented development. Continuing sustainable and inclusive development actions at the center of development, I believe we will look forward to 2030 with even more confidence. So finally, in this regard, I would like to congratulate the UNPAD SDG Center for the event and all of the extraordinary works. And herewith, I launched of the book Implication of COVID-19 on Economics Inequality in Asia. Thank you all for joining today to celebrate the launch of this book. Hope for fruitful discussion further. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Dr. Vivi Yulaswati, for the opening remarks. But before we continue to the session, we also will continue this book launch. Therefore, allow me to also invite the other authors of this implication of COVID-19 on economic inequality in Asia's book to the stage to officially launch the book together, because we will documenting this special occasion. So, to ladies and gentlemen, we please you to join to the stage. Please welcome the book's authors. Give a round of applause to, first of all, Professor Dr. Zuziana SSIMSI from SDG Center UNPAD. We please you to join the stage. The next is Mr. Mustafa Talpur from the Oxfam International. The next author is Ms. Aruj Wahiddar from Institute Business Administration, Pakistan. The next we have Dr. Muhammad bin Abdul Khalid from Institute of Malaysian and International Studies, IMS, at the National University of Malaysia and Saint Pris, University Saint Malaysia. And next we have Dr. Muhammad Abdul Khalik from University of Dhaka, Bangladesh. The next, Dr. Geoffrey Dekange from Ateneo de Manila University, Department of Economics, Philippines. The next, Prof. In Hoku from Seoul National University, South Korea. And the last is Professor Arif Ansori from University of Padjajaran, Indonesia. Yeah, to the honorable books author, we please you to take one, each of you, one by one, take the book. Yeah, ladies and gentlemen, here are the implications of COVID-19 on economic inequality in Asia. Books author, please give a big applause for them. We would like to say big congratulations once again for the book launch. We hope by officially launch this book, it could provide millions of benefit for the reader. Once again, give a big applause for the authors. Yeah, therefore, we will continue with photo session first. Okay, which each author hold the book in front of it. Okay, ready, photo session, begin at 3, 2, okay, maybe, yes. Okay, don't forget to smile. Photo session begin at 3, 2, 1. Once again, 3, 2, 1. Okay, thank you so much. Once again, congratulations for the book launch. We please to the authors to be able to return to the seat. Thank you so much. Yeah, ladies and gentlemen and distinguished guests, let's move on to the next session. Next session, I would like to invite Mr. Mustafa Talpur, the Asia Regional Advocacy and Campaign Lead from Oxfam International, to come onto the stage and present his key findings and research from the implication of COVID-19 on economic inequality in Asia's book. Ladies and gentlemen, let's give a round of applause to Mr. Mustafa Talpur. Mr. Mustafa Talpur, the stage.
First of all, Assalamu alaikum. I would like to thank SDG Center of the Padjajaran University for hosting us here in Jakarta. This has been really a great experience. I have been very fond of Indonesia. I have been here many times in different conferences and programs. But this is a unique occasion where we launched this book and this conference. Just let me brief you on this initiative. In 2018, we worked with few universities in Asia with the purpose to popularize the inequality discourse within the academic circles. There was a lot of discussion when the SDGs was developed, especially on SDG-10. But we thought that the future leaders, either in business or government, will universities. So this is important to inculcate and sensitize the future leaders on the rise of inequality in Asia. So we get together with few colleagues. Some of them is still continuing in this second phase. And we don't just wanted to make noise on the problem of inequality, but purpose was to document the successful public policies in Asia, what governments are actually doing. So the first book that we launched in 2019 in the Chula University in Bangkok was actually implemented the public policies in 7 countries of Asia to reducing, to tackling inequality. These were quite good examples across many countries and different contexts, what governments have been doing. And then after 3 years, we revisited that COVID has actually made everything upside down. This was, in our lifetime at least, is a huge pandemic that has created economic problems and also health implications. So the purpose was to document and see the public policies that were in place long time ago. Are they still in place? What governments did to reduce, and what were the pathways where the inequality and poverty has actually increased in this region? So in this context, this is the book. I will just go over a very few slides on the key findings, and then the authors who are here, the few colleagues couldn't join due to various reasons. But at least we are lucky that we have some colleagues joining in, and they will present on their country specific outcomes. Can we move to the next slide? Is it already? Okay. Yeah, stay on there. It's on poverty, no? So if you see, the COVID-19 hasn't only created the health problem, but it has huge implications on poverty. As World Bank estimated that 140 million people were pushed into poverty in the year 2022 in Asia, and maybe 8 million more in 2021. And there's more or less similar conclusions were done by UNESCAP that 90 million people were pushed into extreme poverty, measured as $1.90 per day. And 150 and 170 million people were pushed into poverty based on $3.20 and $5.50 poverty line in 2021. So these increases have brought the total number of people living in extreme poverty in the region to more than 500 million. So 500 million people are now in this region experiencing poverty. And those in the extreme poverty and those living in the poverty are 1.4 billion people. Very recently, Asian Development Bank has also estimated that the pandemic has set back the progress in the fight against poverty in Asia Pacific by at least 2 years. The region's economic growth this year, what they estimate, is expected to reduce extreme poverty, but only to levels that should have been achieved in 2020. So rising unemployment, inflation, especially the food inflation, also affect multidimensional aspect of the poverty. According to FAO, there were 640 million people in multidimensionally poor in the Asia and Pacific region before COVID, and the pandemic has actually doubled this number. So now they have added 660 million more people in, and they are multidimensionally poor people. If you see, there were in 2019, 58 million workers in the extreme working poverty. People were working, but they were poor. So they were getting a poverty wages in the Asia Pacific region. And this number has increased to 82 million people in 2022. So these are the ILO surveys. So this is the implications that COVID-19 has brought, and as a huge setback to the poverty reduction efforts and the very first SDG. Can we move to the next slide? No, before that. Before that. I think you are moving quick, then I'm the next one after that. Yeah. So prior to the pandemic, Asia Pacific was already suffering from high and rising levels of economic inequality, as we heard from Dr. Vivi. This came out in our research in 2019. Since the 1990s, the trade and financial liberalization and market-oriented reforms have generated economic growth in a large part of the region in Asia. And Asia was the first region they had successfully achieved poverty reduction targets. Over 1 billion people were lifted out of poverty. But this has the cost. This has brought a high level of inequality in the region, because there was economic growth in the region, but with ineffective tax and social protection systems, market imperfections, weaknesses in the governance, the growth has benefited the rich more than the poor, and channeling income and wealth disproportionately into the hands of the few elite on the top. In response, the governments in the region have taken measures in recent years to address inequality. But recently, between country inequality has rose by 1.2% between 2017 and 2021, the first such increase in a generation. So this is a UN escapes calculation. And income inequality within countries has also increased in many countries. Now, if you see these two graphs on the screen, one measures the Gini coefficient of the disposable income and other measures the Gini coefficient of the market income. And you can see the countries. So with the disposable income, Sri Lanka on top and Kazakhstan on the bottom. And with the market income inequality, India on the top and Singapore on the bottom. And then you see all the range of the countries here. But most of the countries on the top one. Can we move to the next slide on wealth inequality? Next one. Yeah, so on top of income inequality, wealth inequality has also increased during the COVID. As of end of 2021, there were 1,020 billionaires in Asia, the people having more than $1 billion in the wealth. With their total wealth was about $4.35 trillion with only 1,000 people. Since mid-March 2020, the beginning of the pandemic, their wealth has increased by $1.8 trillion. In 2021, the top 1% held a fifth of wealth in all countries in Asia and over 25% in 18 countries, if you see in the graph. So Thailand on the top 1% in Thailand, controlling about 43% of the national wealth. And New Zealand in the bottom, because we brought in the Asia and Pacific as well. And then you see Myanmar, India, Philippines, Singapore, China, Sri Lanka, all having over 30% of the wealth just controlled by 1% of the rich people. Can we go to the next slide? So what has been the causes of the pathways that this poverty and inequality has increased by the COVID? First one, of course, is the unemployment. So in 2020, 7.9% reduction in working hours equivalent to 140 million jobs. People lost the jobs due to the restrictions, containment measures, social distancing, and all of that. And by May 2020, 57% of people in Myanmar has stopped working, and 83% of households in Cambodia experienced falling income, and more than 60% workers of travel agencies and tour operators recorded 0 working hours in Thailand. So these hospitality sectors were the worst affected. If you see in the chart, this is the recent ILO data that now in this year, the economies are picking up, growth is picking up, but still there will be 82 million less jobs than compared to the last quarter of the 2019 pre-pandemic levels. So it's a huge number that people couldn't find the work now. Can we move to the next slide? So that was the first pathway where the poverty inequality has increased. The second one is gender inequality, already high in many countries, but the pandemic has exacerbated this further. So in ASEAN, 67% and in South Asia, 80% of employed workers are women, and they are mostly in the informal sector. And the informal sector were the first sector to hit hard by the COVID. And in very first quarter, in very first month, the income of informal workers were fell by 21.6%. And in the second quarter of 2020, the number of women in informal employment declined by 24%. So that was the first part, that how gender inequality increased. But on the second part, the unpaid care work that was already high, the women were performing all these work that is necessary for our societies and economies. To run economies and societies, actually women are subsidizing the whole businesses through their unpaid care work. So cleaning, cooking, washing, taking care of children, elderly, the poor, the sick in the households. And before the pandemic, women spend 11 hours per day on average on unpaid care work. That is 4.1 times more than the men do this care work responsibilities. So this, though the COVID, also men stayed at home, but the care work remained the gendered, and women were mostly doing that part. And that also brought the increased incidences of gender-based violence. So this is how it triggered further the gains that feminist movements actually achieved in last couple of decades to achieving a gender inequality has also got a setback, and it has been reversed. Can we move to next slide, please? The third pathway was reduced household income. Several factors contributed to it. So supply chain disruptions, unemployment, as I already mentioned, labor income fall around 6.6%. The agriculture production also reduced, and the reverse migration happened in many countries. So the job losses, reduced working hours, falling remittances, and lockdown measures reduced income and destroyed livelihoods of many. In India, for example, 122 million people lost their job in April 2020, just in the first quarter of the pandemic. 84% of households reported a fall in income due to lockdowns. Households in Cambodia, Philippines, Myanmar, Indonesia, Laos, and Thailand all suffered income losses. For example, 83%, 70%, 55%, 75%, and 48% household of Cambodia, Vietnam, Philippines, Thailand, and Laos reported fall in income. So disruption to food supply chains, shutdown of markets, and interruptions to the transportation affected the overall availability of agriculture input, and shrinking demand for agriculture products affected the farm incomes as well. Overall, during the first quarter of 2020, it was estimated that COVID-19 pandemic resulted 3.1% or 17 million ton reduction in aggregate volume of agriculture production in Southeast Asia, due to decline in agriculture farm labor affecting about 100 million individuals, their income reduced. The pandemic also hit migration and remittances. The lockdowns, health fears, and falling demand in host countries resulted in reduced, hence reducing income of those families depending on remittances. There were an estimated 87 million Asian-born migrants in 2019, comprising about 32% of all immigrants in the world. For the first time in recent history, the number of international migrants was likely to have declined in 2020 as new migration slowed down and return migration increased. So this was the factor that actually increased the poverty and inequality. Can we move to the next slide? Food inflation and food security. So not only COVID, but then other factors like Ukraine war and rising global inflation affected the countries in Asia as well. So in July 2020, there was 7 to 9% food inflation in India, Indonesia, Malaysia, Nepal, Philippines, and Thailand. About 20 to 22% food inflation in Kazakhstan, Laos, Mongolia, about 29% food inflation in Pakistan, and 91% in Sri Lanka, compared with the same month in the 2021. So you see this huge challenge of the food inflation. How did it happen? The disruption to food supply chains have affected overall production and prices of the essential food commodities. Since the start of the pandemic, food prices have risen consistently. And according to the World Bank commodity price projections, global food commodity price index has increased by 61% than in the 2022 than the level of 2021. Now, this affected the domestic food prices in July. In July 2022, the food price increased 7 to 9%, as I already mentioned, in India, Malaysia, Nepal, and many other countries. But this has also impacted on overall food security in the region. The pandemic and rising food inflation have worsened food security in Asia Pacific and have made achieving the goal of eradicating hunger even more challenging. In 2021, hunger affected 425 million people in Asia, about 9% population. There were 58 million more people affected by hunger in 2022 and 26 million more people in 2021. And the prevalence of moderate or severe food insecurity in the region increased to 25% in 2025. So this is a huge challenge. Again, the progress made to arrest the hunger and achieve the child nutrition targets is also in jeopardy due to the COVID. Can we move to the next slide? On top of all these problems, many countries face the debt problem and their debt has risen. So because governments need more money and fiscal measures to support their people in this troubled time, they increase the health expenditure, the food support, many other subsidies. But because many countries were under debt pressure and they have to meet the obligations to paying the debt. So they were caught really in a very difficult position, either to support their people or pay the debt. So the overall stock of debt increased, the debt servicing increased. For example, just my country, Pakistan, has to pay $15 billion just debt servicing every year. So last year they paid it. So they don't have enough fiscal space really. Their pockets, our pockets are not that deep to parallel do support the people. And you see Sri Lanka defaulted and Pakistan narrowly escaped from the default. So forcing government to reduce the poverty and inequality, reducing expenditures actually. As a result of rising debt levels, Asian government debt servicing burden has increased dramatically. The increase between 2019 and 2021 was 15% of GDP, twice as fast in any other developing region. By 2021, total public debt averaged 71% of the GDP in Asia. Though lower cost of market borrowing meant that average debt service across the region was only 28% of budget revenue. 8 countries were spending more than 35% of their revenue on debt servicing. So more than 1/3 on the debt servicing. Across the region, on an average, government debt servicing was twice as high as education spending, 3 times as high as health spending, and 5 times as high as their social protection spending, and 16 times as high as spending on the climate change. So these are the essential spendings that governments were unable to make while paying the debt. So rising levels of debt and debt servicing have limited government's ability to take actions to fight against rising poverty and inequality and to support the vulnerable groups. With rising inflation and interest rates across the world, plus climate-induced disasters, the government's fiscal capacity to promote inclusive growth will be further hampered in the coming years. Can we move to the next slide? So on top of this short-term income inequality or poverty, the COVID has also changed the structure of economies, and it has a permanent structural issues created in the shape of the loss of opportunities. So it hasn't only caused the rise of income inequality, but it has. So the two problems mentioned, one, of course, it has already been mentioned by Professor Suzy and the Dr. Vivi, that there was a huge digital divide. Having smartphone and internet connection made you able to work online and attend the school, but this luxury was not available to many specific. So for example, loss of learning opportunities because of school closures affecting millions of students, especially from poor and vulnerable households, exacerbated by digital divide, will take many years to be compensated. The importance of access to technology and devices has been demonstrated during the pandemic and lockdowns. Connecting with internet enables workers to work from home and kids to access online education. However, this luxury wasn't available to many, and the digital divide became clearer during the pandemic. Almost 2 billion people are not connected to the internet in the Asia Pacific. Rural dwellers in low and middle income countries, for example, are 37% less likely to use mobile internet compared with those in urban areas. And women are 8% less likely to own a mobile phone and 20% less likely to own a smartphone when compared to the men. So not having access to internet denied timely access by many to critical information related to COVID prevention and public services, including benefits, work options, and e-learning opportunities. In 2020, UNESCO estimated that 10.4 million children in Asia would drop out of school or university forever due to the pandemic. And in third quarter of 2021, schools were closed in 5 countries in Asia and Pacific. And in 2021, UNICEF estimated that about 800 children were out of school, 400 million in South Asia, 260 million in East Asia, and 140 million in Southeast Asia. So this has a huge implications for the future income losses and equality of opportunity. What did governments actually do? Can we move to the next slide? It's the second last. So many governments actually supported their people according to their pockets and the fiscal space. These included direct cash transfer programs. If you see in the book, almost all the governments have multiple packages to support the people through direct cash transfers. There were workers' retention subsidies to the farms, so to reduce the impact of the job losses. There were tax remittances or tax benefits to the companies. There were child tax credits or support in Japan and other countries. There were food subsidies. Many governments provided food subsidies, and utility subsidies are delaying the payment and collecting the electricity bills and other utility. There were increased health spending. Almost all the countries provided free vaccine to their citizens. That's a great. And there were subsidized loans to the small enterprises and businesses to tackle the crisis. Now, these are all great measures. So given the magnitude of health and economic crisis created by COVID, the response were good, but not compatible to the losses. However, these some of the challenges. Details of these public responses of selected countries is available in the book. However, to have any real impact to fight poverty and inequality, it is vital that these programs should be continued for a long time. This means if there is a political will, governments can do a lot. So inequality is a public policy choice. It's not God-given. So if these programs of social protection continued, then there's a chance that governments can achieve SDG-10. Can we move to the last slide? So in the conclusion, despite the low data available, because there are not yet any national surveys done, the anecdote evidence and the paper suggest that the COVID-19 has implications on poverty and inequality, and it is rising it. So what should then be done? So first, of course, is protecting the health. So working together to end the pandemic. So still pandemic is continuing, no, it hasn't gone yet. So in countries where the level of vaccination against COVID-19 remains low and vaccine distribution is unequal, it's vital to scale up vaccination, strengthening COVID-19 testing capacity, developing better treatment and medicines, and ensuring equal access to vaccine. Now, Asian governments should increase investment in public health systems. The weakness of public health system was really in many countries. And if you see the one negative implications of the private health, that they completely disappeared in the initial months. It was entire burden of the health fall on the public health system. So public health systems are vital in these pandemics. So they need to prepare for the future health crisis by building more hospitals, training more doctors and nurses, and making available more medical equipments, and striving to achieve universal health coverage. So that's the first one. Second one is to scope and coverage of social protection has to be increased. Now, expanding the scope and coverage of social protection to achieve universal access. Social protection programs should include all informal workers. Currently, the coverage is very low, mostly sector workers. Lot of agriculture workers, informal workers, street vendors are not part of the social protection programs. So the programs should go beyond pension and cover unemployment, healthcare, and protection of work injuries, and the disabled and other vulnerable groups. The social protection system should provide adequate protection for entire population against future pandemics, climate and natural disasters, and economic loss. Third one, creating equal opportunities and addressing gender equalities. Creating equal opportunities and making up for lost schooling years. It is critical to invest more in public education system with robust monitoring of education outcomes and additional hours for schooling to catch up. It is also important to identify and bring back the children who have been dropped out, especially the girl children. Reducing and eliminating the digital divide by providing cheap and subsidized access to internet is also an essential. And addressing gender inequality by taking proactive measures by government and private sector both to end gender discrimination in pay and access to job opportunities. This may include providing more opportunities to women and creating enabling environment for them. Women's economic and political empowerment both is critical, and increase investment in care infrastructure and care services. So women don't have to spend all the time in the household, and so they can get a free time to reducing their disproportionate burden of unpaid care work, so they can be working as a productive worker in the labor market. And then the tackling the climate change. So Asia Pacific is highly vulnerable to climate change. The recent deadly flood in Pakistan is an example of climate-induced disasters. Therefore, given the opportunity of rebuilding post-COVID economies, countries must expedite the transition to renewable energy. If you see the measures taken, at least two governments, I think Korea and I can't remember other, maybe Malaysia, they actually in their plans post-COVID put in the green technologies. So investing in green technologies and renewable sources. So invest in climate adaptation and achieve their carbon emission reduction targets. Now the final recommendation, all the above measures need the money, no? So you need the resources. Where the money is going to come from? That will be the first question that public policy holders will ask. Now, the only source, either you tax your rich people and companies or you borrow. So if you borrow more, there's already high debt burden. And then that debt comes with many policy options that you have to take from the donors. It compromises your sovereignty and independence. So it has to have from domestic tax revenue. How countries can do it? First is increasing income taxes by introducing taxes on capital gains, properties, and inheritance, and making tax more progressive. Two, broadening tax base. by reducing exemptions, deductions, and incentives. There is a huge tax deductions and exemptions in the ASEAN region. Thirdly, leaving a solidarity taxes on rich and windfall taxes on companies who are gaining a lot of money from this COVID actually, and the oil companies and the food companies profiting from oil and multinational corporations. And then ensuring that value-added tax exempts basic food items so poor are not affected. And then overall strengthening the collection and administration of the tax. So I think this is all. Thank you for very patient listening. I hope I took not more than 5 minutes to the allocated time, but thank you very much for all of your hearing.
Yeah, once again, thank you so much, Mr. Mustafa Talpur, for your thought-provoking presentation. You may to your. All right, ladies and gentlemen, I know that we cannot wait to be engaged in the upcoming discussion, which is our main event in this lovely conference. But before that, let's have a 10-minute refreshing break so everyone can have their coffees and nibbles before we proceed to the next session. So we inform you that our break will start now from now until 10 past 10 a.m. and snacks and drinks will be available in front of our conference rooms, and you might find the lavatories on the corner of the right side of this door. Thank you so much and see you later at 10 past 10 a.m. Thank you.
Cek satu, cek satu, cek satu, tes satu dua. Cek satu dua.
Okay, ladies and gentlemen, we inform you because the plenary session will begin in shortly. Thus, we would like to inform you to make yourself comfortable on your seat provided. We please you to return back to your seat. Thank you. Okay, distinguished guests and ladies and gentlemen, welcome back to the plenary room. For the next session, we will have 4 experts from 4 different universities in Asian countries who will dive deeper and discuss with us about the COVID-19 pandemic and inequality in Asia. Thus, I would like to invite our incredible 4 speakers to come up to the stage and sit on the designated chairs. Ladies and gentlemen, please welcome our speakers. First, we have Dr. Muhammad Abdul Khalid. He is an associate professor at the Department of Development Studies, University of Dhaka, Bangladesh. Please welcome Dr. Muhammad Abdul Khalid. We please you to join the stage. And next speaker, we have Dr. Muhammad bin Abdul Khalid. He is a research fellow at the Institute of Malaysian and International Studies, or IKMAS, at the National University of Malaysia, and adjunct professor at the Center for Policy Research and International Studies, or Saint-Pris University, Saint Malaysia. Please welcome Dr. Muhammad bin Abdul Khalid. And the next speaker, we have Dr. Jeffrey Jukains. He is an associate professor at the Ateneo de Manila University Department of Economic Philippines. We please you to Dr. Jeffrey to sit on the table. Sit on the chair, please. Okay, we're sorry. All right, ladies and gentlemen, not to forget, the session will also be led by a chair and discussion who will guide us throughout the whole forum and discusses on this topic. So without further ado, let's give a warm applause to our chair, Dr. R. Muhammad Purnagunawan, as head of policy team for economic capacity building. And then we have Ms. Athia Yumna from the Smeru Institute to our honorable chair and discussion. We please you to join the stage. All right, ladies and gentlemen, I will hand over this session until 12:10 p.m. to the Honorable Chair. To Dr. R. Muhammad and Ms. Atia, the stage is yours. Thank you.
Thank you very much. So begin Wahida, could you also coming because you are also in the they changed. Okay, so thank you. So good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. May all of you who join us in here in person and also who join us online are always in good health. So as we know, COVID-19 is not ordinary crisis. Nobody will expect that it will affect all of us around the world in such a degree. Right? More than 660 million confirmed case, and with more than 6.6 million death. The pandemic also changed and also affect almost every aspect of our life. It affect our social interactions because of the lockdown and every aspect that actually the government imposed on us. It affect jobs, education, how the way we do our study, how our children actually learn in school and etc. It also affect our religious activity, the one thing that we haven't actually experienced before in any other crisis, right? We cannot do our pray in the mosque, church, and any other pray places. It also affect how the government actually responds to the crisis, because nobody actually experienced this kind of crisis before. But it also have affect our environment differently, right? Because it actually let us slow down a little bit and makes the earth recover, and also change a bit in our climates. We are actually facing the perfect storms, but not everybody actually in the same boat. Some in the yacht, some in the cruise ships, some in the tethered boat, and some maybe in submarine. They doesn't actually feel anything at all, right? So because of that, we can see that it will affect every person differently, and it will definitely will affect how the inequality in every countries, regions differently. We also hear from the previous speakers that it also affect differently between gender, race, ethnicity, and etc. So we are actually fortunate today to have three different speakers in here that will tell us more about this. First is that Dr. Muhammad bin Abdul Khalid. He is currently a research fellow at the Institute of Malaysian and International Studies at the National University of Malaysia, and adjunct professor of Center for Policy Research and International Studies, University Sains Malaysia. He is formerly the economic advisor to the former Prime Minister, Dr. Mahathir bin Mohamad. He also served as consultant to the World Bank, UNDP, UNICEF, UNFPA, UNESCAP, and UNHCR. The second speaker will be Honorable Muhammad Abdul Halik, Associate Professor at the Department of Development Study, University of Dhaka. He is Associate Professor at the Department of Development Studies, University of Dhaka. He has completed his PhD in Development Studies with particular studies on water security, with funding support for the School of Geography and the Environment Oxford University under the project REACH. His research interests include various development issues, impact evaluation, enterprise development, and their constraint, water security, and macroeconomic issues. Our third speakers, Honorable Jeffrey Ducanes. He is Associate Professor at the Ateneo de Manila University, Department of Economics. He specialized in applied econometrics and has published in area of international migration, education, poverty, and inequality. And in 2014, he was awarded the Outstanding Young Scientist in the field of economics by the National Academy of Science and Technology of the Philippines. He is also the board member of nonprofit social weather stations. And our discussion today would be Ibu Atia Yumna. So she is Deputy Director of Research and Outreach Semeru, one of our outstanding research institute in Indonesia. She has been working in development sector and conducting applied economic research in area of poverty, inequality, social protection, health economics, and development economics. Her work has been published in various journals, including Journal of Economic Development, Cultural Change, Health Policy, Planning, and Health Economics. So without further ado, I would like to give our stage first to our speaker. We will allocate around 15 minutes for each of you, so we can have a round of discussion later on. So please, Dr. Muhammad bin Abdul Khalid. Okay. Malaysia. Which country? Malaysia. Malaysia first. Sorry. Khalid. And Khalid. Yeah.
So which country?
Malaysia first.
Yeah, slide.
Just stand here. Can you put the full screen, please? All right, thank you very much. I'll present the impact of COVID on poverty and equality in Malaysia. What do we do? What's the impact, and what's the outcome? What's the policies moving forward? I'll try to do it in 15 minutes. In a summary, we did the containment very well, but we managed the economy quite badly. And the outcome now is still worse than before pandemic. So Malaysia, although the economy has recovered, household income, wages, labor market has not yet recovered until today, because our responses is very poor. Okay, next slide, please. Next slide. We have done very well, Malaysia, since independence. There's some typo there. Absolute poverty in 1970 was half when British left. They left us poor, but we managed to reduce poverty to almost basically below 1%. Gini also has improved. Child maternal mortality has improved. In 1950, for every 1,000 kids born, about 120 would not survive 5th birthday. Now for every 1,000 kids born, only 5 would die. It's equivalent to OECD countries. So we've done extremely well. Education is almost universal. Access to public facilities are excellent. But the impact of COVID has pushed back development by almost 5 years in Malaysia, as if we haven't grown in 5 years. The worst economic contraction in 20 years, highest employment since 1993. And 20% of those middle class has dropped to bottom 40% of household. Many people lost their job. Next slide. Next slide. Malaysia did response quite well. When COVID first case detected in China in November, Malaysia already started the activation plan in December, before any cases become worldwide. So we started very early because we had experience with SARS and MERS from Middle East. So we prepared extremely well. We started very well. Our first death in March, but already closed the border by then. So since March, we stopped. Nobody can come in, nobody can go out. I cannot leave my house. Nothing can be done. School closed. And we vaccinated quite good also. Almost all has been vaccinated, including foreigners. And the best thing is, like, even in Indonesia, everything is free. So it's a very good program. Next slide, please. Next slide. But the impact to the economy quite bad. Income, before, we already have some issues before the pandemic. The inequality went up. Relative poverty also went up. Before pandemic, between 2014 to 2019. Next slide. And COVID make it worse. So before COVID, we have some issues, and COVID make it worse. Malaysian economy shrunk in the past 20 years. This is the first time we dropped quite bad, 5.5%. And employment went up. And for unemployment among the youth is much worse. The unemployment rate among the youth is 3 times higher than those average unemployment rate. In particular, graduate unemployment. We have serious graduate employment. Graduate employment went up by 22%. Underemployment went up by 33%. So we have the impact mostly on youth and graduates. Next slide. Because of job losses, because of underemployment, your income dropped, like what Mustafa mentioned earlier. Median household income dropped by state. When we slice it, poorer state perform much worse, like many other countries. And in Sabah, in Borneo, is much worse. 1 in 4 fall into poverty, and salary also went down. Latest number last month, none of this number has improved to pre-COVID level. So when people talk GDP has recovered, GDP 5%, 6%, I always say, hold on, who benefited? Those who are impacted, not yet benefited. Next slide. And for the first time in 20 years, poverty went up, inequality went up, and it much worse in those poorer state. In some state, it went doubled. Next slide. There's also non-income dimension. Stunting and underweight for children in Malaysia, it went up. We did a study, I led a study for UNICEF. We wanted to see how the low-income household reacted. We look at the diet. We asked them to tell us what do they eat, what they cut on. Most of the increase, the consumption of eggs went up, the consumption of rice went up, the consumption of instant noodle went up by 50%. Consumption of fruits went down, vegetables went down, meat came down. So it became very unhealthy. So the level of stunting we expect to go up. And so there's impact on non-food, stunting and underweight would happen. And also because education that Mustafa mentioned. Although Malaysians have on average one handphone each, but fixed broadband is very poor in low-income states. And when you have online classes, the father has one phone, but 5 kids, everybody has one class at the same time, people would drop out. And the study that we did for UNICEF, we find loss of interest is quite high among school children. About 20% are children not interested to go school anymore. Next slide. So we have impact on economy and impact on non-income, health and education. What's our policy responses to COVID in Malaysia? Next slide. I would say our economic responses is very poor for simple reason. The government was stingy during COVID. They did not want to spend money despite we have money because our subsidy bill reduced because fuel subsidy not being used, nobody travel. So we have a lot of money we did not spend on the people. We spend a very little. You look on the right side, Malaysia spent only 7% of GDP compared to many other countries. Even the size of stimulus is quite big. The government did, I think it was a fatal mistake, irresponsible mistake, because they asked people to withdraw from retirement fund to fund the shortfall of income. And because you ask people to withdraw from retirement fund, right now we have retirement crisis. About half of those who are retiring in Malaysia today do not have enough money to survive for retirement. We retire in about 20 years, retirement at 55, Malaysian expectancy at 75, but you have enough money up to last you for 2 years. So we have a long way, you retire in poverty because the government said, we in trouble, you withdraw your own money. I thought that was irresponsible and for lack of a better word, it's quite stupid. So we did not spend. That's why the recovery is not yet happening, and it created retirement issue. It created another issue. Next slide. So what are the way forward? What can be done? First, inclusive development in terms of job, in particular towards women and those with primary and secondary educated workforce. Upskilling and reskilling is very important. World Bank did a study. If all the women participation in Malaysia in labor force is one of the lowest in ASEAN. If all women work, our GDP will increase by 25%. So we become high income countries instead of upper middle income countries. So jobs remains important. What can be done? Progressive and fair taxation. Personal income tax to GDP in Malaysia is about 2%. in OECD country, about 8%. Is one of the lowest because our tax system is not progressive. For instance, if I earn $100,000 as a worker, I pay 28% tax. If I earn $100,000 in stock gain, I don't pay tax. $100,000 inheritance, I don't pay tax. $100,000 I gain in capital, I do not pay tax. We have one instance during COVID. We are the largest supplier of gloves, largest supplier of many things, but glove. One person in that one quarter, 3 months, he make 2 billion ringgit. 2 billion ringgit is about $500 million in dividend. The tax that he paid was zero. He paid nothing. And we did not impose windfall tax. We asked the companies to donate, which I thought again was stupid. You should impose. So tax in Malaysia is very regressive. So it has to be progressive. Capital gain, dividend, Korea has that, China has that, most OECD country has that. And it should be more progressive. And the social assistance should be progressive. Now it's regressive. Because unlike Indonesia, for instance, our subsidy in oil, which is very high, is towards the upper middle income household, not lower income household. Female workforce participation is another one. We are one of the lowest female workforce participation in the region and in upper middle income country, because we do not support childcare and elderly care, which fall on the burden of women. The last one is social assistance and social protection. A worker is protected if you're in formal sector. If you're in formal sector, you are not protected. Both are workers. So one of the recommendations that we did to the government is that every worker, regardless of sectors, regardless of age, regardless of nationality, must be covered. And the cost to the government is zero because it's by the employer and employee. So that the first. And second, social expenditure and assistance need to be revamped. In Malaysia, we give almost to everybody. It's not targeted, so the depth is very shallow. So the reform in social protection and social assistance is very important. So these are the 4 items that we thought is important to bring forward better. So I stop there. Thank you very much.
Thank you very much. You still have quite a lot of time, but we can use it for discussion later. So the next speaker, the other Dr. Muhammad Abdul Khalid from Dhaka. Please, the time is yours. No worries.
Hello. Okay, thank you. So, this is Abdul Khalik, Associate Professor, Department of Development Studies, University of Dhaka. And I'm going to present on this topic, the impact of COVID-19 on income inequality in Bangladesh. And this is the second chapter of the book edited by Mustafa Talpur. And Dr. Rashid Al Mahmoud Titumid, currently chair and professor of Department of Development Studies, is the leader of the chapter. So my presentation will cover basically 4 items. So first one is that covers the overview of pre-existing inequalities and disparities in the economy of Bangladesh. It focuses on 3 major issues. First one is income inequality, and then consumption inequality, then access to labor force participations, and income inequality or wage inequality. and then it will focus on health and education sector. So, so please move forward. So thank you. Welcome to my presentations. So I have just outlined my chapters. Okay, fine. Let's go next slide. Next slide. So as mentioned, so my presentations covers the income inequality. So the previous slide, please. Previous slide. Previous. Okay. So we have used the Gini coefficient indicators to assess the income inequality. And we have presented the government data, and the data has been generated from household and income expenditure survey, which is conducted by Bangladesh Bureau of Statistics. It covers the trend of inequality between 2010 and 2016. 2016 was the latest publications of the government in terms of poverty and inequality statistics. And if you see the Gini coefficients of income inequality for the national level is around 0.483, okay, and which is in a rural area around 0.544, and this is around 0.498. So it's basically in terms of income inequality. If you see, so in rural area, the income inequality is a little bit lower compared to the urban areas. And if you see in 2010, the income inequality was a little bit lower. For example, at national level, that was 0.458. So, and similar statistics you can see in urban areas. And we see that income inequality has increased in Bangladesh compared to in 2016 compared to 2010. And we can see the pattern of inequality in between rural areas and urban areas. And in both areas, the inequality has increased. But if we look at in terms of the depth of inequality, for example, so the share of income of the lowest 5% was around 0.23 at national level in 2016, and which was 0.78 in 2010. So basically, it also showing the increase in inequality. And if you look at the top 5%, the share of income basically has increased. So in general, income inequality measured in terms of income, so we see that there is an increase in inequality, but where we consider it consumption inequality, we'll see some static pattern, albeit some a little bit increase. So in terms of consumption, so the inequality, Gini coefficient inequality is around 0.324 at national level, and it is around 0.3 at rural level, and it is 2.333 at urban level. So next slide, please. So then we have tried to see the pattern and discriminations due to sex in labor force participations and wage pay. So we can see that around 80% of the male has access to labor market, whereas only around 30% was of women has access to labor force participations. And we can see there is a clear distinctions between in terms of pay between male workers and female workers, and the pattern has increased compared to 2013 to 2016. And similar disparities exist in between rural and urban areas. The urban worker basically is getting higher wage or higher return to their labor hour compared to the rural areas. So next slide, please. So we know Bangladesh is basically depending on the informal sectors. Most of the labor is engaged in informal economy. And the COVID-19 basically affected the first sector, which is informal sector, as Mustafa Talper mentioned that the informal sector is highly affected by COVID-19. So if we look at that, workers of informal sectors first lose their jobs, and around 6 million jobs has been lost by COVID-19. And most of the job losers were basically women. And although the urban economy is affected first due to COVID-19, but later on, it has shifted to the rural areas, and the economy becomes stalemate due to the successive lockdowns and economic restrictions. Okay, next slide, please. As you know, the health sectors of Bangladesh was not as good prior to COVID-19, and it has affected the health sector severely because there was less number of doctors per lakh populations, and we didn't have sufficient hospital facilities, and that has been further exaggerated because of COVID-19. Although at the early stage, the infections rate in Bangladesh is low, the fatalities rate was low, but was worried about COVID-19 because Bangladesh is a populous country. The population density is very high. So outside the country, the major talk was that the Bangladesh may suffer severely due to COVID-19, but that didn't happen. Because COVID effectiveness was low in terms of fatalities and infections in Bangladesh. By the way, the vaccine facilities in Bangladesh was earlier was limited, and primarily the urban people get the vaccine facilities first, then later on the rural households. Next slide, please. The most talking sector was education sectors. So the durations of school closures was highest in Bangladesh compared to other countries, and around, according to UNESCO data, Bangladesh had the highest durations of school closures, around 61 weeks, and it has disrupted the education systems of Bangladesh, and you know, the people of Bangladesh has limited access to digital device like smartphone, computers, and in rural areas, the situation is much worse than the statistics. So, you know, the students didn't participate in class. Most of the girls was even absent after resume of the classes. And there is a mental health issues, okay? And similar pattern is observed in other countries. And so if you see, the school closures was basically high in the less developed countries compared to developed countries. So this kind of school closures has affected on the students' performance in terms of their skills in maths and even the simple text readings. And the mismatch between the lectures or contents of the specific classes and the required skills of the students, we can see that this is affecting the learning skills of the students. So the learning loss in terms of education due to COVID-19, so that may affect the long-term inequality of the country, because that will reduce their human capital, and that will affect ultimately their academic accumulations and wealth in future. So next slide, please. So we have seen disparities or inequalities in the labor market, in health sector, and in educations. And it has widened the disparities or inequalities between classes. And you know, Bangladesh government has financed the vaccinations, and it has announced economic incentives for its business class, and it has given social safety net supports to the people at the early stage. And government has tried to tackle the situations wisely and efficiently. But despite, if you look at the pattern of giving economic incentives and supports, we can see there is a disparity. For example, the earlier of COVID-19 that has increased the income erosions and loss of businesses and the productions of agriculture, including other sectors. But most of the incentive has gone to the rich people. The rich gets the better economic incentives compared to the poor. Okay, and large business firms gets larger incentive, whereas small was outside of the incentive packages, because it's all about the power structure exercise of the country. So the elite class exercise the power, they can access to the resources easily compared to the poor. So poor has limited power and to exercise the power. So then if we look at so last section, so creations of new poor. Okay, so COVID-19 basically generated the new poor in the poor pool. In fact, it has expanded the problems of poverty. Okay, it has increased the vulnerabilities to poverty. It has increased not only the transitory poor, but also the permanent poor. So in terms of poverty, we can see that in Bangladesh in 2016, the poverty incidence was estimated around 24%, which has declined 21% around in 2021. But the research suggests that it has already close to doubled to the amount, and government is planning to reduce the poverty at the current level, so that they can achieve the SDG goal of reductions of poverty on time. So in a nutshell, we can see that the pattern of incentives and power structures is basically expanding the inequality in Bangladesh. Next slide, please. Okay, so in a nutshell, we have exercised the power structures of the country, and I have mentioned the low-income households and farmers have limited power. On the other hand, government is the major player of the power structures, and rich class public service officials has also important roles in these power structures. So Mustafa Talpur has just summarized a lot of recommendations in elevating inequalities and poverties in his presentations. I think that covers most of the issues that has been discussed here. But I would like to conclude my sessions by explaining the last one, please. So this is the summary of my presentations. So COVID-19 basically has brought the patterns of cracks in our economy, and it has expanded the crack patterns in our economy. It's not only in terms of contractions, but it's also diversifications of the cracks. And it has exaggerated the pre-existing faults and incentive patterns, employment opportunities, and coupled with the problems of war and food price inflations and general inflations is creating the problems of poverty and inequality in our region as a whole. So my one message is, and one recommendation is that we have to ensure a policy that will give equal opportunities to women in terms of gender, sex, regional location, whatever. So every person should get the equal opportunity in education, in health, and others. So no one should leave behind. Thank you so much. Thank you.
Thank you. Thank you so much. Just in time. So our next speaker will be Jeffrey Johnson. Thank you.
Good morning, everyone. So I will be presenting on the impact of COVID-19 on inequality in the Philippines. So there are many similarities between the Philippines and Indonesia. So maybe you can identify some of the impacts also that I will be presenting. Next slide, please. So this will be the outline of the presentation. So I will first give a very brief background on the impact of COVID-19 on the Philippine economy and why there is reason to believe that the inequality was and could be significantly affected even into the future. I then discuss my hypothesized transmission mechanisms from the impact of the pandemic to inequality. After that, I go to the main results. So the main results I divided into different groups. So first is the short-term impact of the pandemic on inequality. By short-term, I only mean the period of hard lockdowns in the Philippines, which occurred intermittently until April 2021. In the Philippines, the hard lockdowns were called Enhanced Community Quarantine or ECQs. So when you see ECQ on the slide, that means the hard lockdown. And then second, I described the potential of the pandemic to drive longer-term inequality in the country. After that, I summarize and conclude. So this slide shows that the COVID-19 pandemic has exacted a heavy economic toll on the Philippines. It has caused the largest year-on-year decline in the Philippine GDP in its entire recorded history and put a stop to its longest streak of consistently high GDP growth. So in 2020, Philippine GDP declined by 9.5%. Given the population growth of the Philippines, that means that per capita GDP declined by almost or more than 11%. The employment of the impact of the pandemic was equally severe as might be expected. After reaching its lowest level of 5.1% in 2019, the annual unemployment rate more than doubled to 10.4% in 2020. In fact, in April 2020, the unemployment rate was 17%. And even in 2021, as you can see from the slide, the unemployment rate was still about 1.5 times the pre-pandemic level. It was not till very recently, maybe a quarter ago, that unemployment rate returned to its pre-pandemic level, although the quality of employment is still significantly affected. Next slide, please. According to the ILO, the Philippines lost the equivalent of 7.2 million full-time jobs in 2020 and 3.2 million full-time jobs in 2021. Based on data from the Philippine Statistics Authority and other sources, we know that it has also increased poverty and hunger. In this presentation, I also argue that it has likely increased inequality immediately during the hard lockdowns or ECQs and possibly in the medium to longer term. Next slide, please. So the study uses the following data sets. So first is the Family Income and Expenditure Survey, or the FICE. The FICE is the data set used by the Philippine government to come out with official poverty and inequality measures. The thing is, it only comes out every 3 years. It is of limited use in the estimation of the impact of COVID-19 because there was no FICE in 2020, which was the height of the pandemic and movement restrictions in the Philippines. The second data set is the Annual Poverty Indicator Survey, or APIS, which is conducted twice every 3 years. So on the years there's no FICE, there's the APIS. It contains only a broad income variable, so not very detailed, but it has many non-income measures of poverty. So there was an APIS in 2020, which was conducted close to the height of the movement restrictions. So it's very informative. And finally, I also use the Labor Force Survey, which is the official source of unemployment and labor force statistics in the Philippines. It is conducted every quarter. Next slide, please. So just to show what was happening to inequality in the Philippines before the pandemic, so whether you look at per capita income or per capita expenditure, the Gini ratio has been declining in the Philippines since 2000, but most especially since 2012 up to 2018. Of course, we know that household surveys underrepresent higher income households. So in levels, this is probably an underestimate, but for as long as there is no increase in the underrepresentation, maybe it gives you a good idea of what was happening to inequality. Next slide, please. So there are various channels through which the COVID-19 crisis could have impacted inequality in the Philippines. So the first one is through the differential impacts of the pandemic on different economic sectors. The sectors most affected by the pandemic, especially initially, were those that entailed close physical contact among workers or between workers and clients. These include construction, lower-end or non-automatized manufacturing, retail trade, personal services, like barbershops or spas, and public transportation. Many types of work in the informal sector also fall under this category. To the extent that workers in these sectors are lower skilled, as you would expect, and lower income to begin with, compared, for example, to workers in finance, education, and utilities, then their loss of livelihoods could exacerbate income inequality. A second potential channel is through the additional restrictions that were imposed during the strict lockdowns, which were biased against lower income households. For example, the extended prohibition of public transportation during the initial lockdowns meant that workers who did not own private vehicles and who were beyond reasonable walking distance from their places of work could not resume their jobs. Next slide, please. So just to show you, for example, this is a table showing the private ownership of vehicles in the Philippines. So it is highly unequal, as might be expected. Only about 1% of households in the lowest income quintile owned cars or jeepneys, compared to 29% of those in the highest income quintile. The ownership of motorcycles or tricycles, which are more limited forms of transportation in terms of the number of passengers that they can accommodate or the distance that they are allowed to travel, is more equitable but still highly unequal. Note that the households with no private vehicles would also have greater difficulty going out to purchase food and other basic necessities during the ECQ, which was very harsh in the Philippines. For example, people 6 years old and older, they are not allowed to go out at all. And also people under 20 and 21 years of age. Another example of ECQ restrictions possibly contributing to inequality is the prohibition of face-to-face classes and of young children going out altogether during the ECQ, which potentially disadvantaged working women with children who had to spend more time doing household chores and supervising the schooling of their children. I will present evidence on this later on. Next slide, please. And then just the last one. So a third potential channel is through the unequal access of households to technologies that for workers would enable work from home arrangements, and for students would allow access to online schooling and online resources during the pandemic. These technologies include ownership of computers, tablets, mobile phones, as well as broadband connection. Lack of access to technology for online education could disadvantage the future earning potentials of affected students and thus have long-term impact on inequality. I likewise present evidence of this and equal access to technology later on. Next slide, please. So since there was no FICE conducted in 2020, Gini ratio measures of income comparable to those I presented earlier is not available. But in the 2020 APIS conducted in July of the year, and which asked questions about mostly income, about monthly income in the first quarter, which was mostly before the pandemic, and in the second quarter, the beginning of the pandemic and when lockdowns were strictest, the data shows a higher inequality during the pandemic as denoted by a higher Gini ratio. This occurred as mean monthly household income declined across all income quintiles, with a decline higher in percentage terms for the lowest quintiles. As a result, the lower quintiles have a smaller share in total household income in the second quarter, as can be seen from the slide. Next slide, please. Income inequality increased at the beginning of the pandemic because lower skilled workers who were more likely to belong to low-income households bore the brunt of initial job losses, as shown in this figure. So this is related to the first and second transmission channels I mentioned earlier, since the sectors most affected by the pandemic and the lockdowns in the second quarter of 2020 were wholesale and retail trade, construction, transportation and storage, and manufacturing, sectors where workers mainly occupy jobs requiring relatively lower levels of education. So the slide shows that the increase in the number of unemployed were higher for those with lower education levels. Next slide, please. In a different paper that we wrote, which attempted to tease out the effect of the lockdowns on employment outcomes, so it teased out the effect of the lockdown from the effect of the pandemic in general, we found that the selective imposition of hard lockdowns mainly had the effect of reducing hours worked rather than employment per se. But more to the point, we find that the effect of the ECQ on hours worked was somewhat unequal. So higher for males than females. But again, note that we don't count in the labor force survey, we don't count household work as employment. So in that sense, this is kind of misleading. Highest for those in the youngest age group, meaning the 15 to 24 compared to those in the older age groups, and higher for those with lower education compared to those who finished college or post-secondary schooling, likely because degree or even diploma holders are more likely to be in jobs amenable to work from home arrangements. Next slide, please. So in another study, looking only at women, we found that the hard lockdowns affected women with children more than those without children in terms of paid employment. So the hard lockdowns reduced the probability of paid employment for women with children by significantly more compared to women without children. And moreover, the negative impact of the hard lockdowns on the probability of paid employment increased with the number of children. Again, the likely explanation is that the increased care responsibilities of mothers during the ECQ, given that children were forced to be at home and to do distance learning. Next slide, please. So now looking at the impact after 1 year, so this means during the first semester of 2021, so we look at the income poverty statistics released by the PSA based on the FICE data for the first semester of 2021. Okay, just a brief digression. I'm sure you hear about poverty incidence, poverty gap, and poverty severity. So just to explain what they actually mean. So the most widely used income poverty measures are the 3 Foster-Greer-Torbeck indices, which are poverty incidence, poverty gap, and poverty severity. Poverty incidence is just the share of households or individuals who fall below the poverty line. So in the illustrative data in the slide, for example, assuming a 5,000 peso poverty line, this means that the 3 countries, country A, country B, and country C, all have poverty incidence of 30%. Poverty gap, meanwhile, is a measure of the shortfall of the total population from the poverty line. So for 2 countries with the same poverty incidence, the one with the higher poverty gap have poor who are farther from the poverty line on average. So looking at the table once again, the poor in country A are collectively 3,000 pesos away from the poverty line. The poor in countries B and C are collectively 6,000 pesos away from the poverty line. So countries B and C have a higher poverty gap compared to country A. Poverty severity measures the inequality among the poor. So for 2 countries with the same poverty incidence and poverty gap, the one with the higher poverty severity indicates that there is more inequality among the poor in that country. It's the same as saying that there are more extreme or severe poor in that country. So if you look at the table again, if you compare country B and country C, though collectively they are the same distance from the poverty line, there is more inequality among the poor in country C compared to country B. As a result, poverty severity there is higher, as you can see also from the bottom rows of the table. Okay, so next slide, please. So this table actually shows the FGT indices for the Philippines for the first semester of 2021 compared to the first semester of 2018. So it shows increased poverty incidence in the Philippines during the pandemic, reversing a decade-long pattern of declining poverty. It also shows the poor were generally farther from the poverty line compared to 2018. And more importantly, the table shows there was greater inequality among the poor in the Philippines in the first half of 2021, as indicated by the higher poverty severity. Next slide, please. I now describe the potential for longer-term impact on inequality. The COVID-19 pandemic and the ECQ, as we know, suddenly forced students in all grade levels into remote learning mode. Given the short time the education system and teachers have had to prepare, the quality of remote learning was likely inferior to the face-to-face learning that was in place before the pandemic. And again, this has potentially negative impact on the future productivity of this cohort of students whose education was affected by the pandemic. And because of this, this can have a large impact on future inequality. Moreover, because access to remote learning resources is highly unequal, with less access to those from lower income households, students from lower income households are likely to suffer greater learning deficits. So for example, this table shows ownership of a personal computer or tablet, cell phone, broadband connection, TV, and radio by household income quintile in 2020. It shows ownership of personal computer or tablet is tremendously unequal in the Philippines. Ownership of cell phones, which is likely inferior to personal computers for remote learning purposes, is more evenly distributed but still favors those in the highest quintile. 1/4 of households in the lowest quintile reported not having any cell phone. Access to broadband connection was even scarcer and also unequal, with less than half of all households reporting having this type of connection. Access to mobile data is not available from the EPIS dataset, but is likely also to be highly correlated with income. Even TV ownership is still unequal, with close to 40% of households in the lowest quintile reporting having a TV compared to 95% for those in the top quintile.
Okay, Jeffrey, could you fast a little bit?
Okay.
2 more minutes.
Okay, almost done. So if the future productivity of poor children is affected disproportionately because of substantially less access to learning resources, this could lead to higher inequality later on. Next slide, please. Okay, just to say also that unequal access to personal computers and broadband connection contribute to inequality in other ways, such as by making access to health services via telemedicine unequal, and by limiting the ability of those without access to work from home opportunities and online training opportunities. Again, this could impact both short-term and longer-term income and non-income inequality. Okay, next slide, please. Okay, these are the different types of government responses because of the pandemic. So mainly cash grants given to households and people who lost their work. Next slide, please. And just to show that the incidence of benefits from these different programs is also highly unequal. So these are the access to the programs as of June 2020. Of course, the programs extended beyond that period, but the 3 months from April to June 2020 were the critical period when the lockdowns were strictest. So as you can see, only 46.7% of households reported receiving a cash grant, and the incidence was not that progressive. It was progressive, but perhaps not progressive enough, with still 45%, for example, of households in the lowest quintile not receiving benefits as of June 2020. The support provided to workers is also very small and also not progressive enough. So, for example, the cash grant to formal sector workers is highly regressive because people with low education, low income, usually they are not in the formal sector. The cash grant to those who lost jobs to the informal sector, it covered very little or very few people. And then the cash grant to overseas workers who lost their jobs, also highly regressive because those who are able to migrate from the Philippines are mostly from higher income households. So just to conclude, next slide, please. The COVID-19 pandemic has exacted a heavy toll on the livelihood of many Filipino households. I presented evidence that some subgroups of Filipino households were more affected than others, likely increasing income and non-income inequality in the country in the short term and potentially in the longer term. Inequality that existed prior to the pandemic, such as in access to social security, in educational attainment, and economic opportunities, in access to digital technology, has contributed to the unequal impact of the pandemic across households. Okay, thank you for your attention.
Thank you, Jeffrey. So before we have a round of questions, we're gonna let Ibu Atia Yumna to be a discussion for this session, please.
Thank you, Pak Wawan. First of all, I want to actually congratulate Oxfam, especially Mustafa and friends, that have been consistently advocating, documenting the stories of inequality in Asia, not only the stories of and condition from the big economies, India, Indonesia, China and Korea, Japan, but also from other countries that we had here. So last time in 2019, we had like Mustafa had like 7 countries on board, but now you had like 10 countries. So congratulations to Mustafa and all of the friends here. So my first impression of this book is actually I really enjoy the reading the book, even though maybe just a glimpse of stories from countries or from each countries. But yeah, my first impression is I really enjoy the story from other countries that make me feel that Indonesia is not alone in this pandemic. Even I'm feeling like very relate to myself as I also experienced the COVID. My families and other friends here is similar, has similar experience with other with friends in other countries. So that's the proximity that this book is given to me myself. So that's my second point. Related to the substance itself, we know already that this pandemic, the COVID pandemic, we are not ready in developing countries. Even in developed countries, we are not ready yet. If I'm, that's my point of view. Then the impact is wide, very wide. It's beyond economic. It's beyond monetary measures. So we heard the stories of inequality, not only in income, not only in consumption, but also we heard the stories about the gender inequality. We had stories about the wage gap between formal and informal sector, and also learning loss in education sector. Even stories about the environment. I read about the story on environment in Pakistan case, as well as the mental health in maybe in every countries, but not as articulated in this book. But yeah, that's the proximity that I had reading the books. Even though I think I just realized that the title of the book is Implication of COVID on Economic Inequality, but actually the substance of this book itself, it's beyond economic inequality. So I think that's more I don't know, it's blessing in disguise or not, that we come to this crisis and we realize that our life, our humanity is increasing right now, not only within countries, but also across countries in the world. So we, from that perspective, we know that we have experienced uneven losses, uneven recovery, both within countries and across countries. So I think we have to, kind of monitor, not only right now, we have experienced 3 years, but still we have to monitor thoroughly this impact of pandemic in the not in the short term, but also in the medium and longer term, because we heard the story about some groups that some groups of our population that are left behind, children, as well as women, especially the female-headed household that experience more severe than the other than male-headed household, and also in Indonesia, particularly the elderly. So the bottom of the poverty in Indonesia is experienced by elderly household. So that's also the one group that I think it's not neglected, but kind of excluded from our point of view. The other groups that are I think comes in our studies at SMERO as well is people with disability. They experience more severe experience with this COVID. People with disability need to have the rehabilitative therapies that they could not do it in the pandemic time, as well as people with children with disability that it will affect their longer term health outcomes. Yeah, and also people with lower education. I think Holly or Jeff has already mentioned about the people with the lower education that they are very vulnerable to this kind of pandemic, even though digitalization, especially in Asia. I recall the Indonesian case. Digitalization in Indonesia is very massive, but then we had also the very big digital divide, the very wide digital divide between Java and outside Java, or maybe in Filipino between South and North, maybe in the other places as well. So that's the other point from me, as well as I think the informal sectors. This is particularly a very distinctive feature of Asian economy, I think, where informal sector dominates the economy. I think in Pak Arif's paper and Prof. Suzy paper, it's also highlight about the increasing informal economy in Indonesia after the pandemic, in the third year of pandemic, from 55 to 60%. That also show us how the vulnerability of this informal sector can be really impacted by the pandemic. And I think that the one that also maybe neglected or somewhat not in our our plate is about the vulnerability of the marginalized group. It can be ethnic minority, it can be LGBT groups, etc. So this is I think the one that maybe missed out from the book, but we can talk and discuss later in this occasion. So the point of the vulnerable groups is about the impact of long-lasting of this pandemic, long-lasting impact of the pandemic on our future human development and well-being. It could be the health outcomes. It could be the learning loss that can impact it, the way or the livelihood of our future children, poverty as well as inequality, and their poverty, and as well as their status of inequality in the future. So I also read about the report from World Bank in this year, reported that the lessons from countries respond to COVID-19 belongs to three issues. The one is fiscal space. Mustafa has already highlighted in the beginning how countries can tackle this pandemic with their fiscal space. So the poor countries have to borrow money through the donor, and we in a state of their sovereignty, in a sense like that, and otherwise we have to increase our tax system. That's the lesson from this pandemic. The second one is around the program itself. The social protection program is how to reach out who are on needs, especially in the informal sector. And the third one, the World Bank also highlight about the delivery system of its social protection itself. So that's I think that's already covered by papers from all friends here. So to be known, the last one is about the takeaways way forward from this event or from this discussion is to enhance shared experience. We know other stories from neighborhood countries from very similar or even not similar context with our country. So that's also become enrichment for us to thinking out of the box how to tackle this kind of crisis in the future, as well as an assistance to our colleagues, to our friends in other countries, as well as the collaboration between the one who already have the system to tackle the pandemic in more systematic way or in a more good way and then to share it with others that have not been really good on that. So yeah, we still have the challenges as said by others here, conflict and war in Ukraine, and maybe in another episode of conflict and war in other place. Inflation because of the conflict and war as well, related to conflict and war, especially on food inflation. The third one, the third challenge is about the digitalization and digital divide. Natural disaster. I reckon this becoming Indonesian experience. I think Bangladesh also have the similar experience on natural disaster. So future pandemics also becoming our challenge, as well as our children learning loss during pandemic. That's I think that one is the main challenge in our future human development. And for the last one, I want to share the slide from the T20 on social, particularly on task force on poverty and inequality. They have already put this policy recommendation to G20 through T20 belongs to I think it belongs to three main recommendation. The first one is establishing a comprehensive, inclusive and innovative social protection system to prepare for future shocks, pandemics. It's not only about COVID. Maybe this is COVID 1.0. We still have in the future maybe COVID 2.0 or 3.0. So we have to be prepared on that kind of crisis. The second one is about the enabling accelerated and inclusive learning and skilling to achieve resilient education systems and reap demographic dividends. This is the second recommendation related to our human development and in the future. And the last one is about the measures of our economic growth or our economic achievement, yeah, instead of beyond GDP, beyond gross domestic product, as a proper prosperity measurement. So we need to think about that in more detail outside the GDP. That's my last slide. Thank you for the opportunity, and we can discuss and elaborate later. Thank you.
Thank you, Bu Atia. So yeah, we have around 30 minutes for question and answers. So I want to open the first sessions. It's going to be 3 questions from the audience. Please state your names and institution, and also where your questions going to be directed to. So the first one's lady on the left. And then the second one, Ibu. And then the third one, Ibu. So all ladies now, it's good. Please.
Okay, thank you, moderator, for the chance that's given to me. I'm Tania from CISD. My question is addressed to all speakers that may answer this question. So as we know that Indonesia is predicted to experience a recession in 2023, I mean, this will certainly have a major impact on all aspects. Even the impact has begun to be seen. Some private parties have started layoff of workers even on a large scale. The question is then what about a marginalized group such as disabilities, women with children, indigenous people, as we know that these groups maybe is the most impacted by recession, and it can cause the social inequality in Indonesia getting bigger. And according to the speakers, what can we do, or what can they do to survive, and what they need to prepare in this year to face the 2023 later. Thank you.
Thank you.
My name is Esmeralda. I'm from Bina Nusantara University in Jakarta. And like from your presentation, all of you mentioned about the challenges that particularly women face in this pandemic by losing job and also taking care of the family. And you also mentioned that the informal sector is the sector that is most impacted by the pandemic. But my questions is, do you think that, because especially doctor from Malaysia mentioned that actually if women get job, it means that the economic of the country will actually become a surplus. So my questions is it possible, for example, if we see entrepreneurship as a solution for this particular group, despite of the fact that you're saying informal sector is quite fragile, but is it a solution that government needs to take into considerations in order to, on the one hand, supporting this vulnerable group, but on the other hand as well, supporting the economy of the country? Thank you very much.
Thank you.
Tes. Assalamualaikum warahmatullahi wabarakatuh. My name is Ayurisa Dominata from National Research and Innovation Agency, Indonesia. Actually, Asia is the relatively stronger in fighting COVID-19 because of the availability of rich natural resource and the strength of the local population. So how do the speakers analyze Asia's potential to become a world leader in the future? What are the opportunities and challenges? Thank you.
Okay, so now we have 3 questions. Maybe who would like to answer first? Should be simple and concise. Please. Sure. Maybe the first and the last. Maybe the second for the.
Okay, so thank you very much for your important questions. So you were asking about the effects of recessions, if I correctly pick up the words, and the effects of recessions in 2021 on marginalized group like disabled and others. So particularly if you see they are already in deprived situations. So in any case, this kind of effects that will affect badly on these groups, because most of the disabled persons are basically dependent on various transfers and others. In case of Bangladesh, I've seen that around 7% households have at least disabled persons in their family. And due to recessions and the bad conditions of the world economy, that will affect the economy of the developing countries as well. So if you see the risk of the country, COVID-19 was that was not the country specific problem, that was a global problem. And now, so the global economy is look like as another problem, so that will affect the entire world. So they will, from my side, that will affect the marginalized group badly. But we have to take care of them through the social safety net programs, so that they can sustain, that they can tackle the situations. And the second questions was about women entrepreneurs have solution to tackle that problem. So as you know, the most vulnerable peoples are from non-self-employment activities, like, so the laborer was basically the most vulnerable groups. They cannot tackle this kind of unexpected, unanticipated events. So entrepreneurships give them good support and self-employment activities. So surely I will say that entrepreneurships could be a good solutions to tackle this kind of situations. So thank you. I think that's okay. Thank you.
Okay, just to add to the answer to the first question. So how do you try to help the vulnerable groups in case there is a recession in Indonesia next year? Was that the question? I think like somebody was saying earlier, the COVID-19 experience and what the government's responses have been is already very helpful. There were a lot of good things that governments did, because if you really think about it, the pandemic is really two things. It's a health crisis, but then it also became an economic crisis. And a lot of what the government did was to try to address the economic crisis. So the cash grants, unemployment, the expansion of unemployment insurance, and so on. So I think the government can try to do the same thing in Indonesia in case that there is a recession next year, especially targeted cash grants for the vulnerable groups who are heavily affected. For the second question, women and informal employment, they are really very strongly correlated. For most countries, the informal sector is dominated by women. And I think the answer to that is increased formalization. Formalization in the sense of when we say some businesses formalized, it only means that they are registered. So one problem with the informal workers during the pandemic was that a lot of them were not registered, and so the assistance, which is based usually on the list that the government has, they cannot be reached because they are not on the list. So there should be a heavy focus on formalization in the sense of registering them. And to be able to do that, there are many good experiences. So subsidized contribution to Social Security, for example, and then making registration as easy as possible, possibly even incentivizing the act of registration itself by, for example, one-time tax exemption or freedom from payment of a specific fee, and so on. Okay, I think I'll end there.
Yeah, I'll try to add what my two friends here mentioned. The first on recession, not just in Indonesia, but also in many countries. The first rule should be to protect jobs. And to protect jobs, support to firms is important, in particular in wage subsidies. I think that is more optimal than other forms of intervention. That is number one. I think governments has to support firms in terms of wage subsidy. But the second, what not to do is do not cut tax. Many countries, they would like to cut tax during bad times. Even during COVID, many countries cut tax because they still believe that it would trickle down, it support business, promote investment. There's no proof. And countries that cut tax or cut revenue usually would go down badly. Recent example is Sri Lanka. They cut the GST, they reduce it, the bracket, they also reduce it. And England, so stupid, they follow it and they got into crisis. The Prime Minister changed 3 times. Never cut taxes. It should instead increase or expand tax, especially to make it fairer and more progressive. I think that's the key intervention, what to do, what not to do. On the question on entrepreneurship, Ibu tanya tadi ya. In it depends on what types of women who lost their job or not in the labor market. In Malaysia, those who not in the labor market are also very educated women. The labor force participation of women is very high, up to their late 20s. The moment they get a child, it dropped. In Korea, it went back again. In Japan, it went back again. So it's become like a W. In Malaysia, it's an inverted U. It never recover. The reason is because unpaid care work or to take care of the child, and because we are aging to take care of the parents, fall into the woman, educated woman, so they do not enter. So for this kind of problem, entrepreneurship is not the answer. The answer is, how do you ensure that parents are being taken care of and child are being taken care of? So it's specific to certain countries. And entrepreneurship is for low-income people is important, but that issue of taking care of parents and children still fall to low-income household. So how do you also address that? I think that is more important. And soalan terakhir daripada Ibu Ayu ya, Asian, how do ASEAN to be a potential world leader in the future? Yeah. ASEAN, I'm talking about ASEAN, not ASEAN. ASEAN, our population is bigger than European Union, bigger than North America. To do well, to be a world leader, Indonesia must do well. No disrespect to Philippines, Malaysia, or Vietnam, or Thailand. Those are not important. This country must do well. And from the views of ASEAN countries, in my personal view, I think Indonesia is doing very well. G20, they're doing well. They try to intervene in OIC. They do with Ukraine and Russia. The image is strong. The image is becoming world power. I think in 1 or 2 decades, it's going to be the 4th largest economy in the world. Indonesia cannot fail. Indonesia has to do well. It cannot be Malaysia. Malaysia, our time has done. At that time, even Pak Mahathir, Pak Suharto, they did very well. In Kuan Yew, we have strong men. Now, no more. Only Indonesia has less. So I think the key will be your next president election 2024. It has to do well. Indonesia do well, everybody will do well. Indonesia doesn't do well, ASEAN not going to do well. Thailand, forget about it, military leader. Philippines and Malaysia, some issues. In Malaysia in particular is political issues. We don't have strong leaders at the moment. Singapore takes sides. They are lucky of Americans. But here is very important step. So your question is, this country has to do well. Thank you.
Thank you very much. Maybe Bu Adia would like to add some.
Okay, I just want to add about the vulnerable groups in how we tackle the vulnerable groups in maybe in future recession. I think I agree with all the speaker on how to tackle this kind of issue, but I think make them visible is the main thing. If we can't even name or know the groups itself, so that then all those assistance, all those social protection system is useless. So we have to make them visible. That's my short question, my short answer. And the second one on entrepreneurship, I think it's not. I think it's easy answer, but it's not so easy to implement or to do it. As Pak Khalid said, that unpaid care work is particularly in Asian context is very what you say, it's very crucial to us, to our families, to take care of families, and it is not calculated as the it is not calculated as economic activities, as Mustafa said earlier as well. So this kind of unpaid care work is I think it should be becoming our next agenda on how to, it's not only because it's also rooted in our tradition, in our cultures, yeah, about the unpaid care work. So the education about how to balance roles between male and female in our families, it should be also boosted. So it's bullshit if we, you know, if we advocate or campaign about the gender equality, but then we ourselves it's ignorant or it's just campaign, or it's just bullshit of gender equality, but ourselves it's not really implement, or it's not really inherently do in our daily life. That's my short answer as well for the second one.
Okay, thank you very much. So we still have quite a lot of times. So I'm gonna have another round of questions. First, Bapak, Ibu, and then 3. Okay. So I think nobody on the left, right? So we have 2 more here. Okay. Please.
Thank you. Terima kasih. I'm Rinsan Tobing from Save the Children Indonesia. First of all, I would like to thank all of you because you highlighted the children's rights about the education, which is our mission as an organization. My questions, especially for the discussion from Smeru Institute, what do you see different in these 10 countries in responding to this crisis in terms of the capacity or the political will or whatever you can find out, okay, that is quite fundamental in making such a decision like cash transfers and so on. And the first question leads to the second questions. I have a kind of perception that this pandemic or this crisis is not hard enough in terms of, I don't see any social or public tension, unrest in Asia that is triggered by this crisis. There is no demonstration, huge, what do you call that? Let's say unrest. Okay, in Indonesia, even there is no such things happens. So I think probably, okay, this is just my opinion. It can be wrong, it can be debatable, but it's not hard enough. But again, as you mentioned, Ibu, that this is COVID-19 is like 1.0 version. And we have to be ready or prepared for the, let's say, COVID-19 2.0. So what is the takeaway from this? Still going on, actually, but I mean, what is the takeaway? What is the lesson learned? Or what is the knowledge that must be captured from this COVID-19 0.1 to be ready for 2.0 version or type? Thank you.
Thank you. I'm Devi from SDG Center Universitas Jember. Yeah, from the presentation, almost all the government policies from the 3 countries presented about cash transfers and also subsidies. Do you think that this program is still effective during post-COVID-19 pandemic? And is there any indicators that as a guidance for the government to continue or to stop this program? Thank you.
Okay, thank you for the opportunity for me to give a question. My name is Luhur. I'm from Universitas Indonesia, and I want to give a question related from your previous answer about the tax policy As we know, in Indonesia, there are some tax policy given by the government. I curious that is there any tax policy implemented in your country to prevent or to strengthen the condition after COVID? Thank you.
Okay, because we still have one more question, so just
Yeah.
give it one more.
All right. Good morning. I'm Alce from Social Watch Philippines. I want to build on the question of Madam over there. It's regarding the debate between universalism and targeting as a mode of provision of social protection packages. So how would governments would be able to operationalize or balance them out? And what should be the outcome of this debate now that because of what happened in COVID-19? Really, it exposed our health system, our overall holistic, our overall aspect of our living. So that's it. Thank you.
Okay, thank you. Because quite a lot of question is for you, Bu Atia, please.
Okay, the first question on differences between countries in experiencing pandemic as well as the response to pandemic. So from my readings, but I reflect that these 10 countries, I think we have similar experience on the impact, but then we have a bit differences in how to respond because of previous experience in related to experience on the crisis before. So countries like Korea, Thailand, Indonesia, we had experienced the big Asian financial crisis. So that from that crisis, we have built some foundation of system, especially the social protection system that they already in our system. So but then countries like Bangladesh maybe, and as well as Pakistan has not already built that kind of system, social protection system. But this is from my point from my reading. So correct me if I'm wrong, colleague, as well as friends from Pakistan. So that kind of experience and exposure to respond to previous crisis has already gave our as a basic or a foundation to tackle this kind of crisis. But I think the huge difference between this crisis with previous crisis is related to, because the initial crisis is the health one. So we kind of I think it's every country and it's huge crisis. So I think every country has difficulties to cope with those kind of health outbreak. Yeah. So this is also to answer your question, your second question about the how we prepare to the future pandemic. I think that the first thing first is to improve or enhance our health system. If it's done, then we have to we can run more faster than we've done right now. I think so that the health system should be strengthened in a more systematic way. That's the second answer for your second question. And for the I think I want to continue with the question on guidance of social protection program. I think Indonesia has a lot of experience on social protection program, and it's evolved. I think we kind of have evolution social protection programs since the Asian financial crisis. We have first social safety net that time, 98 to early 2000, Bu. So that's only the the bantuan sosial, yeah, so social assistance. But then we developed that kind of system into the social assistance, even though social security is already input as well but only for formal sector, for a civil servant, for military, for police. But then after that, in 2000, after the Asian financial crisis, we developed that the coverage is more wider. Even now we have the informal sector, the social security for informal sector, even though it's the coverage right now, it's still very in a slow pace, yeah. But and then the evolution of social assistance program, I think, is also related to the vulnerability of the groups, population group. For example, for children and women, we have in Indonesia right now PKH, the conditional cash transfer, so that it's already in there, the system. The assistance is for the women and children in the household. Sorry, women in the household that have pregnant women or children that are still in the school, so that they can the children, we make sure that the children go to school up to, I think it's senior high school, yeah, Pawan, yeah. So that kind of social protection program, I think Indonesia has already experienced evolution how to do it. That's the third question. Tax policy, I think it's not for me. Yeah.
Thank you. So next, Jeffrey, would you like to answer?
Okay, thank you. On the first question, I would just like to comment. In the Philippines, at the height of the pandemic, that was also the time when Duterte was the most popular. Social SWS, which I was a part of, it conducts this quarterly survey, and Duterte got like net ratings, so approved minus disapproved, of about 80%. And as academics, you were wondering, how can this happen? There's so much hunger, there's so much suffering. Why is the president the most popular now? And the thing that we thought we can think of is that for most Filipinos, they were not blaming the government for what happened. It was something external. And even though they got very little support in terms of cash grant, in terms of food, at least they got some support. So something that was not the government's fault, the government supported them still. So I think that was the reason. But I think if something similar happened again, because of the experience, most people probably think that, well, they should know better now. So if something happens again, it's still the same. Maybe their view will be different. I don't want to preempt the other the presentations later in the policies and the discussion, but let me just note that I think the three other questions are very closely related. So should universal or almost universal cash transfers continue rather than something conditional like the conditional cash transfers? Should there be a tax policy? Then the other one is okay, so those questions. My background is economics, so I'm of the view that in case of a big emergency like the COVID-19 pandemic, it has to be more universal, because the act of targeting itself, it takes a lot of time. When many people are in danger of going hungry, then there's no time to waste on all this proxy means testing that you have to do, the difficulties in allocation, so make it universal. But in case of a non-emergency situation, then I think you have to weigh the both sides, because you cannot really do universal without the corresponding tax policy. If you cannot do the tax policy, you do universal, your government will go bankrupt, and then it will affect maybe the more important social sector spending that is more targeted, that the government has to do in the first place. Okay, I'll end there.
Okay, so thank you very much. First, I would like to answer about social safety net programs in Bangladesh. Bangladesh government is planning to implement the life cycle approach of social safety net programs. Like the government is trying to give support to at all levels of lives. For example, the students are getting services from the government's school scholarships for the students, grants, and creating incentives for the unemployed peoples, and giving supports, allowance, for example, old age allowance for the women and men at the later stage, and creating incentives for women entrepreneurships. Okay, but in case of answering critical situations, what could be the social safety net options? So as answered, in case of emergency, we have universal safety net supports. In Bangladesh, we have seen that at the early stage of COVID-19, when the middle class also needs some sort of supports from the government introduces open market sales, OMS, but somehow because of targeting, most of them was outside of that support, and there was mismatch. And in general, social safety net package is well known to us because of mistargetings and other issues. Anyway, that's all. And second questions about tax policy, Mr. Khalid will answer, I think, on more details, and I agree with him that tax cut, why tax cut is not a good solution during a crisis, because the tax cut basically supports the richest one who has exercised power structures, and they can get benefit from these, because the disadvantaged and low income people are not in the tax bracket. And so therefore tax cut will not help them, but rather they will support the rich class. Like what I have seen in presentations that the economic incentives of subsidies or transfers has gone to the richest class. So in case of indirect transfers, the better groups are getting the opportunities. So in that case, how can we support the disadvantaged lower income groups? And I will agree with Khalid that progressive tax impositions that will help basically the disadvantaged groups, and through the social safety net package programs, they can help the disadvantaged groups. Thank you.
Maybe I add a bit. The first question, why there's no demonstration in this part of the world? Because everybody stay at home compared to other parts in Europe and others. Although there are pockets in Thailand, there are social unrest. Remember the 3 fingers that they did in Myanmar, even in Singapore. In Singapore, when they did the election during COVID, Singapore government ruling party, PAP, got among the lowest popular votes in history, almost among the lowest, because dissatisfaction with the reactions to COVID. In Malaysia, everybody at home, but what they did in social media, it was they do a tagline, kerajaan gagal, failed government. People put white flags at the window and the government fall. Twice changed the prime minister. So while it doesn't seem like people on the street, there are dissatisfaction either through the polls, like in Singapore, or on the street as in Thailand and to a certain extent in Myanmar, and in Malaysia, the government pressure to the government and the government fall. On soalan Ibu Dewi, should we continue? World Economic Forum says that we should build back better. I thought that was a wrong statement. You should build forward better because the bank was not good. The issue that we have exists even before COVID. Unemployment, lack of social protection, women participation, blah, 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 blah. So those the reforms that we need, how to make sure growth is inclusive, progressive taxation, progressive social assistance, should continue. I think not to continue as before, should reform to do better. And this related to the last question of Pak Luhur, mengenai income from tax. Tax still important. The idea, the argument that I mentioned earlier, do not cut tax, is true. Studies have shown. Even you look in history, America and even to a certain extent UK grew the strongest after World War II up to 1970s, when the top marginal tax rate in America was 93%. If I make 1 million at that time, government would take 93% of my money. In England at that time, about 80, 84, 85%. Only when Reagan and Thatcher come, they cut. The growth has been as fantastic as during that period. Even now, the most competitive economies are the Nordic countries, the most free, the most Islamic, whatever indicator is always Nordic countries, Denmark, Sweden, Finland, and Norway. The average top marginal tax rate is 54%. And yet, tax avoidance is among the lowest in the world. Why? The tax rate is among the highest in the world, but tax avoidance, people pay tax, people do not avoid. Because when they go out from their house, the train system works. Public services, efficient. If I'm sick, it was paid for, free. Education, free. Maternity leave, 2 years, taken care of. I pay for this, I see this. And the reason why that happening, and this again, I want to relate to the last, how to make ASEAN better, and in particular Indonesia, corruption. There's almost zero corruption, not tolerated corruption. If you look in ASEAN countries in particular on corruption index, Singapore is number 4. Singapore is corrupt, but they do it smartly. But they are corrupt. Even Europe, France, until 1990, you can corrupt foreign entities and you get tax deduction if you're French companies. Only up to 1990s. They bribe every other people and they get tax deduction. So they shouldn't lecture us. Singapore, they're smarter than that. But Malaysia, we did very well in 2018 when we kicked out the former Prime Minister. We put him in jail. He's in jail. I think one of the rare Prime Minister in ASEAN who's in jail. And soon, probably, the deputy also going to go to jail. Corruption is very important to improve. Aside from Singapore, I think number 4, number 5, whatever. Malaysia and Indonesia is almost 96, or Thailand much lower. I think increasing reform tax without addressing corruption would not work. Addressing corruption, integrity, governance should come first. And we should follow China. If you corrupt, you just shoot them. Easy. Line up against the wall, shoot one by one in public TV. Because to address corruption, no point to catch at the bottom. You must catch at the top, and they should be punished severely. Then we eradicate poverty. Then we eradicate corruption. Then we become powerful. Thank you.
Thank you. That's quite a strong conclusion you have there. So, because we are actually around out of times, and I don't want to block you from your lunch, so I'm just gonna have some bit remarks on this session. So, first of all, I would like to thank all the presenters and the discussion for our discussion today. I learned quite a lot, and I hope you all also learned quite a lot. We see in here that we can learn from experience from other countries, how their government actually try to drive along during these pandemics, how to make their country safe, and what actually it gonna affect the citizen or the countries, right? We can see also that there is some success, some failures, some still, some already recover, and some still below the condition before the pandemic. There is different policy responses in there, but we all agree that I think the governments really learned something from this pandemic, and we still have, all of us here, to push the government to reform all the policy that they have, to continue to make the policy better, and to make the governance of these whole things getting better. And then we also need also to remind us that there is still some thing left due to this pandemic. the digital divide that makes some of our students left behind could still pose threat in the futures. So we still have some works to do to fix that. And it's not on the governments, but it's on all of us. So I think that's all from me. Thank you very much for the organizers and all of you today. Thank you.
Thank you very much. Give a big applause for the incredible speakers and also our chairs. What a wonderful and fruitful discussion. And next to the speaker and chair, before leaving the stage, we please you to stay, because next we will have the session of placard and souvenir handover, who will be given by Professor Dr. Zuziana SSI MSI as Director of SDG Center University of Padjajaran. To Professor Dr. Zuzi, we invite you to join to the stage. Yes, and the first placard will be given to Dr. Muhammad Abdul Khalik from Bangladesh. Yeah, once again, thank you so much, Dr. Muhammad Abdul Khalid from Bangladesh. Take a photo session first. Okay, and next. Okay, the second placard will be given to Dr. Muhammad bin Abdul Khalid from Malaysia. Once again, thank you so much. Okay, photo session first. Okay, thank you. And the next placard is given to our speaker, Dr. Geoffrey Dukens from Philippines. Once again, thank you so much, Dr. Geoffrey Dukens. All right, and next to our chair in discussion, first will be given to Dr. Erpuna Gunawan from Indonesia. Thank you so much. And the last placard is given to Miss Astia Yumna from Indonesia. Once again, thank you so much. Okay, ladies and gentlemen, we please you to be able to return to the seat. Thank you so much. All right, ladies and gentlemen, I believe that all of us still have a burning question in our mind right now. However, unfortunately and fortunately, we will still have to proceed this session with our lunch break now, since it's already 12 o'clock. So we will have our lunch break from now until 1 p.m. sharp. And for your information, the committee has prepared the lunch buffet at the hotel restaurant at the first floor. And for the information, for our Muslim college, if you're looking for the praying room, the room is available at the edge of the left from these conference rooms, or you can also do prayer in your room. Just do not forget to come back, because we will have another session after the break. And we still have one announcement. Before we continue to the break, we please you to all participants to come to the registration table in front of this room. If you haven't done yet fill the registration for the local transport link. Once again, to all participants, do not forget to fill the local transport link. If you haven't done yet, please come to the registration table in front of this room, and the link barcode is available at the registration table, and we'll be waiting you to fill the local transport link until 2 p.m. Okay, that's all, I think, the announcement. Thank you, everyone, and see you around at second plenary session at 1 p.m. Thank you so much. We inform you once again, ladies and gentlemen, you can enjoy the lunch at the restaurant at the first floor of this hotel. Thank you.
The world is facing an unprecedented time where society, the government and corporations need to move at the same pace and at the same time. Collaboration in breaking the barrier collectively is needed so everyone can recover together and stronger. The Civil 20 represents the voices that are at the heart of every policy made by the people in power. These voices are essential to all the lives on this planet. Voices on the well-being of migrant workers and vulnerable groups, on access of global health and vaccines, on women empowerment and equality, to the issue of the environment's sustainability. These will be fought for through 7 working groups: vaccine access and global health, gender equality, environment, climate justice and energy transition, taxation and sustainable finance, SDGs and humanitarian, education, digitalization and civic space, and anti-corruption.
COVID disrupted the school systems across the Pacific in every capacity. So even at university level, our biggest university, the University of the South Pacific, wasn't able to help their students stay in contact and finish their units and their courses.
We need a lot of vaccines to come. For instance, since December, we have run out of stock of AstraZeneca. So there are many people who maybe took first jab and they are waiting to take the second jab.
Kita yang wira swasta ya, yang utama sekali yang paling dirasanya ekonomi gitu. Kita nggak bisa kadang-kadang kalau kayak kaki 5 kita dagang begini, waktu kita dibatasin, prokes ya wajib lah kita dalam kondisi lagi begini kan. Itu aja kalau dampaknya gitu.
Masih banyak paradigma bahwa kami itu adalah orang-orang yang dikutuk, orang-orang yang menularkan suatu penyakit.
Recently, the Japanese government is promoting gender equality, but the progress is slower than planned. The gender gap in Japan is the largest among OECD countries. The youth are not happy living with conventional gender stereotypes.
These are the actual challenges that we need to address together. The voices, ideas, innovations, and solidarity of the society are key to a change at scale. The Civil 20 brings these voices to the table of dialogue with the government and the people who are accountable for the change.
I think that what governments can do, especially the government in Fiji, is allocate more funds for education. So we need more teachers and we need more support for teachers.
The government has to procure more vaccines to support the citizens or engage more development partners who will support us so that we get more vaccines in the country.
Pemda apa pemerintah pusat buat membuka lapangan kerja yang nggak berbelit-belit persyaratannya, terutama kayak yang tamatan SMP, mereka cuman punya ijazah SMP buat bersaing. Ini kan susah gitu.
Tolonglah hadir di tengah-tengah penyandang disabilitas. Perhatikan untuk dari sisi kehidupan kami-kami ini, terutama dari sisi ekonomi. Lakukan pemberdayaan yang bersentuhan langsung seperti wirausaha, karena sesadar-sadarnya bahwa penyandang disabilitas itu tidak semua memiliki latar belakang pendidikan yang baik.
Thanks to the civil society, we have seen some improvement, but there is still so much more to do. We, the youth, are striving for a Japanese society that respects individual people and their choices.
This is the time for us to work together and tackle challenges with the people and for the people, collaborating hand in hand so we can give everyone the opportunity to not just survive, but also to thrive. Breaking the barrier of borders, ideologies, and beliefs, ensuring that no one will ever be left behind. It is time to move together to recover stronger. We're here to make your voices matter. We're here to make sure that you are heard.
Okay, good afternoon, distinguished delegates and ladies and gentlemen. Welcome back to the plenary room of the International Conference Achieving SDG-10 Post Covid-19 Pandemic and a book launch, Implication of COVID-19 on Economic Inequality in Asia. I hope everyone has had a wonderful lunch and has their energy recharged for the upcoming session. But before we proceed to our next plenary session, first of all, I would like to invite Professor Andy Sumner and Dr. Eduardo Ortiz from the King's College London to share their warm remarks to all of the conference participants today. Ladies and gentlemen, let's give a round of applause to Professor Andy Sumner and Dr. Eduardo Ortiz. Gentlemen, the floor and screen are yours. Okay, can you hear us, Mr. Eduardo?
Thank you for inviting us to present to the meeting today. Myself and Eduardo are presenting on the issue of global inequality and global poverty in the aftermath of the pandemic. So clearly, these are two very big, important parts of the Sustainable Development Goals. You have this sort of the first goal of ending poverty in all its forms, obviously very sort of important and very strong emphasis on this, but also there's an SDG on reducing inequality within and between countries, SDG-10. So what are we going to do? We're going to introduce two papers that we've written together with others. Both of the papers are based on the same data set. Ultimately, the data set has been constructed from the World Bank's POVCalNet database, but with some important differences. So with POVCalNet, the real constraint is you can't observe individual incomes, you just get a poverty rate at a given poverty line. What we've constructed is a new database we call it the 10 cents database. Why is that? Well, the database is built by computing the cumulative share of the population below a set of thresholds, and we work up 10%, 10%, 10 cents, then 10 cents, 10 cents. So we identify the number of individuals in every range, and then we set each individual's income at the middle value of the bin. So these income distributions allow for global inequality analysis and global poverty analysis. So let's start with global poverty. So this is based on a paper published in Third World Quarterly, also with Chris Hoy as a co-author. So there's a received narrative around global poverty, and that is that global poverty has fallen dramatically. COVID has increased poverty, but not by an enormous amount, perhaps about 100 million, maybe a little bit more. And then only 1 in 10 of the world's population live in absolute poverty, or perhaps 1 in 4 if you take a slightly higher poverty line. What we argue is a counter-narrative. We argue it's misleading to focus on the lowest poverty lines. We argue that new measures are needed in thinking about poverty. Actually, the things that matter and are valued, being well-nourished, completing primary education and other aspects of well-being, are more likely to be associated with a higher income or consumption line. Perhaps even $13 a day, which is a consumption line associated with a very low probability of falling back into poverty in the future. If you take any of these higher lines, you immediately find much higher levels of global poverty and absolute poverty, and actually the pandemic and its aftermath has made this worse, and also the context looking ahead is very, very worrisome. So say something first about the concept of global poverty. The line $1.90 has been extensively used. It's from the World Bank line, a World Bank estimate based on the value of the average of the poverty lines in a sort of very poor countries, 15 poor countries in particular, and then been adjusted with for prices over time. There's also a $3.20 and a $5.50 line. These are the averages for lower middle income and upper middle income countries. We would also add in our work a $13 a day line, which is the line, as I mentioned, where the probability of future poverty falls to very low levels. These, of course, are changed over time as new price data, and in particular international price data to compare across countries becomes available. Actually, the $1.90 has recently been updated to $2.15 because of the 2017 PPP data. Here we use $1.90, and that's what we've used throughout. Two observations. First is, as I mentioned previously, there seems to be a much stronger correlation when you look at poverty rates for health and poverty rates for education with higher lines. So we think $1.90 doesn't really capture enough. It's too minimal. Also, the sensitivity of the poverty line at that level of the global population is such that very small differences make a big impact on the number of poor people. So, for example, if you went to $2.50, which is the average poverty line for all developing countries, not just the poorest 15 countries in the World Bank set, it immediately adds 500 million more poor people. And this is important because when we come to talk about the pandemic and the poverty impact, a very large amount of people, not about a large amount of people just above the poverty line is really a recipe for vulnerability and insecurity, particularly due to economic slowdowns or lockdowns as a result of, as happened during the pandemic. So what we see is this shift over time prior to the pandemic, whereby the global population shifted from the left to the right. And you had, if you look at any of the poverty lines that we've drawn on here, the three poverty lines, 190, 320, and 550, you have this overall shift, which is positive, but what it does mean is a large number of people are not that far above any of those poverty lines. And so if you want to see what this means in terms of absolute numbers of people, what we have here is the number of people in millions living below each of the poverty lines if you move up 10 cents by 10 cents by 10 cents. So while it's true, at least prior to the pandemic, the global poverty count was about 700 million under $1.90. The moment you go up to even the $2.50, you add, as I mentioned, the 500 million more people. But also, as you move up, you keep adding people because the number of people the poverty count is incredibly sensitive to the poverty line set, particularly at the lower lines. It also has a big impact on the location of poverty. So there's again a received wisdom that poverty is very much a sub-Saharan Africa located, and there's much less poverty in Asia, and particularly East Asia. Actually, as you move up poverty line, that starts to change too. So as you go up towards $3.20 and even $5.50, much more of the global poverty count is accounted for particularly by South Asia, but also to some extent by East Asia, particularly as you move up to the higher lines. So what about the pandemic? So there are two ways that people have tried to understand the poverty impact of the pandemic. One is the World Bank's estimate, which is to take growth forecasts and look at what they imply for poverty levels. An alternative view we've pursued is to look at, well, what happens if you increase the value of the poverty line by 5%, 10%, 20%? How many people are vulnerable to falling back into poverty as a result of a shock? And what we find actually is potentially much higher numbers, and perhaps numbers that aren't really well recognized. So actually, and even a 20% income shock was not unheard of. You think of the contraction in India, for example, in terms of GDP, and it's not, we'd never know for sure how much of that fed through to households. But nonetheless, potentially there could be up to 500 million people who are vulnerable for falling back into poverty, or may have fallen back into poverty because of the pandemic, at the higher rates of sort of a 20% income shock. And it's not just about people falling back into poverty, it's about an increase in the intensity and severity of poverty as well. So we made some estimates, and we found the intensity of poverty could increase by 60%, even at the lowest poverty line. And what this really is about is many countries have been successful in reducing poverty at the $1.90 line, but many people are not that far above that line. So ultimately, this is really a question of a large number of new poor people, people falling back into poverty in middle-income countries. So again, we tend to associate poverty with low-income countries, with sub-Saharan Africa, but actually as a result of the pandemic, there may be many people in East Asia and South Asia who fell back into poverty simply because they weren't that far above the poverty line. So that sort of leads to a set of questions in terms of the discussion. So I mean, the first is, why are the World Bank estimates so modest? Well, they're based on growth projections, and those growth projections do change over time. Historical assessments of growth projections tend to show they're quite unreliable, especially during crises and GDP contractions. The IMF's growth forecasts that are very well used across agencies, development agencies and the private sector, aren't actually based on a global model. There's no underlying methodology. They're desk estimates or subjective judgments, as Sanderford and Subramanian noted in their paper. The World Bank forecasts do have an underlying model, but it's not publicly available. We don't know what the assumptions are about commodity prices or other aspects, and there's not sufficient detail to replicate them. So it's really a question of not quite sure. And ultimately, the detail that is available suggests that there is some kind of subjectivity built into the process. Estimates on growth forecasts may well be maybe over optimistic, because it assumes each household is equally hit by contractions. And there's a real question about this thing that in a technical term would be called the pass-through rate. That's the pass-through rate from national accounts or GDP contractions to household expenditure. World Bank uses 0.85 for the pass-through rate, except in India where it's lower. This seems very optimistic to us. It implies a full economic contraction will not pass through to households during a GDP contraction. In reality, I think an economic-wide shutdown may actually impact household welfare more. So I think there's really sort of an underestimation there of the poverty impact of the crisis. So these are technical but important issues. Why do over-optimistic estimates get used? I think because if they weren't used, it would imply that the government actions and international agencies simply aren't doing enough or haven't been effective at reducing poverty as much as has been presented. I think communicating trends based on these indicators suggest business as usual would be absolutely sufficient to end poverty. So there's no need to think about new models of economic development. There's no need to think about major national and global redistribution, which would be more important if you thought about poverty at higher poverty lines. Also, I think adopting a less optimistic approach and higher poverty lines makes it obvious that poverty is not necessarily residual and something that's left behind. It may actually be endemic and part of low wages, or which has political implications. It may be that more national and global redistribution is necessary, and as I mentioned, a much more fundamental think about the model of economic development and whether it should be more focused on domestic markets rather than global markets in its emphasis. I mean, finally, I just think it's easier to accept optimistic statistics than challenge those statistics. The challenge the statistics implies a whole sort of questions for policy and politics, and I think that's a really kind of important consequence. So what would be better? I think new measures of poverty are needed. We think that I think there's a particular importance to the security from future poverty line, which was developed by Lopez Calva and my colleague Eduardo Ortiz Juarez. So at about $13 a day in 2011 PPP. We also need to add to that, I think we can look at longitudinal studies. The Indonesian Family Life Survey is very famous. We need to think about how to connect monetary-based poverty to valued outcomes. So what kind of income or what kind of consumption is necessary to achieve a certain level of health or education, and how may that differ quite dramatically across countries depending on the welfare regime, the set of social policies in place. So just to summarize, I think we're really sort of questioning this global narrative that you see reproduced in many places, that poverty has fallen very dramatically. We think actually COVID has increased poverty by more than 100 million, although some of those people may move out of poverty again. I think the shock has been far worse than perhaps we necessarily have been, we think. And then actually, I think there's also this question about, we tend to think of poverty as 1 in 10 of the population, or maybe even 1 of 4, but actually it's higher. So to summarize, we think it's misleading to focus on the very lowest poverty lines. We need new measures that associate poverty lines, monetary poverty lines, with valued outcomes such as being well nourished or being healthy and being educated. I think in addition to those in the world that live in poverty, about half of the world is in some form of sort of day-to-day poverty, or depending on the line taken, the insecurity just above that poverty. And I think the pandemic has made that more problematic. I'm going to hand over to my colleague now, Dr. Ortiz Juarez. Thank you.
Thank you so much, and thank you again for the invitation. So now after we developed this set of papers on global poverty, we started to discuss what would be what have been the trends on global inequality, and especially what could be a potential pathway in terms of these disparities in income among the population in the world. So exploiting again this new data set that we constructed, we embarked in this project on global inequality with this co-author, Ravi Kambur. So the paper is available in different outlets. So the main motivation is we have observed that according to different definitions of global inequality, and I will talk a bit about it in a bit more, there has been a narrative of decline in inequality. But at the same time, we have seen some trends of inequality increasing within countries. But still, I mean, despite that, the consensus is that global inequality has been reducing over the last years. So there is also a consensus that what is the source of that decline, which is basically a very rapid pace of growth of per capita income in China and in other large emerging economies. But here's what we argue. We argue that this narrative of declining inequality over the recent decades has boosted a narrative of falling global inequality that has been rather oversold, in the sense that we argue could be temporary. This is not necessarily a trend that we will be witnessing over the next decades, and rather that global inequality could start increasing at relatively soon and at important magnitude. So, and we will argue. I mean, it has been discussed in many circles that the pandemic has exacerbated issues of inequality, especially within countries. But we have some evidence as well that it has exacerbated global inequalities. But still, our argument, and we will show that with a model, a very intuitive model and some empirical analysis, that the potential reversal in global inequality could have happened even without the pandemic. So before going to the model and the empirical analysis, it is important to clarify the different concepts of what it's usually said about global inequality. So on one hand, we have the concept related to, or that is known as international inequality, which basically compares the differences in income between the average citizen of each country. So basically, it takes the GDP per capita of each country, that is the average, right? And it assumes that each country is a single unit represented by this average individual, and then measure the level of concentration of income or of GDP per capita among these countries, which is 197 countries or territories for which there is data. And we, in many circles, this concept was used because we simply didn't have the proper data to analyze the interpersonal comparison. So, but the question is here, if we use this concept, whether countries should be treated as equal units, regardless of their size. No, and very important implications when deciding what concept to use. For instance, just as a very quick representation, we have this data for Brazil and China, and if you look at it, in 2018, both countries had a very similar level of GDP per capita, but what happens when in the next year, in 2019? So GDP per capita in China expanded at around 6%, whereas in Brazil, GDP per capita virtually stagnated. So of course, there is a statistical fact that above 1 billion inhabitants in China experiencing almost 6% will certainly have some effect in between country inequality. And when we are measuring global inequality using this concept, we are basically overlooking that statistical fact. So there is a different concept which takes into account the population, the different population of each country. So of course, it weights by population. So it's basically the same concept, but acknowledging this. But by doing that, it assumes, therefore, that each individual in a given country has exactly the same amount of income represented by the GDP per capita. And then this concept overlooks that there is a gradient within that economy from the very poor individual to the richest individual. So this is what we used to have. So there is this concept 3 of global inequality, which acknowledges that there exists actually this gradient. So instead of using the GDP per capita or any other national average of a monetary measure, it assesses the interpersonal disparities in income by exploiting the household surveys, which are pulled together and consider the world as a single unit. So we are comparing the differences in income or consumption among individuals across the world. So this will enable the analysis to account for the within country disparity, but also to have the between country perspective. And this is what we use. This is a concept that was being popularized by Branko Milanovic, and by taking advantage of that data set, we are now exploiting this Tencent data set and to analyze, of course, the past and to look for consistency in what we already know what has happened in terms of declining inequality, but we will take this evidence and this data set to project the potential distribution of income in the world toward the future. So this is the issues with I used at the beginning. So we know that inequality has been increasing in some countries, global inequality in general in the world, using this concept that I just explained, has been declining, mainly driven by the growth in China and other large economies. Even if within country inequality has been increasing, in general in the world, global inequality has been declining. So, but we argue this narrative is perhaps just temporary, and that soon we could start witnessing a reversal in inequality. What is the intuition? So we propose a mathematical model in which we find the exact turning point. But the intuition is as follows. Think of the world as composed by simply three economies. A high-income economy, represented by the Mickey Mouse, a middle-income country, represented by the panda, right? Let's say China, right? And a low-income group of countries, let's say Africa. So this is the starting point. What happened? Now consider what happens if, in relative terms, the panda moves upwards. right? So if you look at the first set in this chart, you can see that there is a big gap between the panda and the Mickey Mouse. There is a big gap between the middle income economy and the high income economy, and a much smaller gap between the middle income economy and Africa in this case. If the panda experiences growth, it will be starting to close the gap with the high income economy, and of course expanding the gap relative to the low income economy, right? So as this process continues, which has been the case of China in actual terms, has been expanding at very high rates. So since the gap between China and the US is much bigger to start with, this effect dominates and global inequality starts falling because the panda is moving closer to the US, right? As China, in this case, represented in this case by this figure, gets closer to the US, the consequences are further closing this gap, right? While increasing inequality, because the gap between China and Africa is getting bigger and bigger and bigger. So this is related. This is perhaps something familiar to you with the famous Costner's curve, which traces inequality as the population moves across sectors. For instance, in this case, from the agricultural sector with low income towards the industrial sector with higher income. So at the initial stages, these shifts of the population start increasing inequality up to a peak and plateau from which inequality starts declining because there are more and more people in the high income sector. This is something related to our arguments, but with a twist. This is not related necessarily to population shifts across countries, but this is more related to relative growth of per capita income. So what we have is a U curve, not an inverse curve, in which if the middle country grows relative to the low income and high income country, first we will start seeing that global inequality will decline, which is what has happened over the recent decades, but then it will start increasing because of these mechanics that I just explained. So, I'm sorry, it is not about shifts of the population, it's more about shifts in relative per capita income. So, using these distributions, see what could happen. So first, very quickly, the past, our results, our database is very consistent with past evidence, so inequality has declined as measured by the Gini coefficient or the mean log deviation, especially since the early 2000s. This is very consistent with the evidence from Labner and Milanovic. The drivers of this decline, it's mainly the between country component. So the income between countries have been closing, the gap have been closing, and this is what explains most of this decline. So, but what about the future? We use the database and we project the income distributions, the global income distribution towards 2040, let's say, using two distribution neutral scenarios, just to take into account, just to isolate the effect, this between country component driver. Okay, so let's assume that the world, and this is supported by past evidence, let's assume that the countries in the world return to their previous path of growth observed in between 1990 and 2019. We call this as a very optimistic scenario. So they start experiencing again the previous rates of growth. Or a less optimistic, they return to a growth path, but at a reduced pace. So what could happen with the future inequality? What we observe is that when we measure the inequality, global inequality using the Gini coefficient, this there will be a reversal used in both the scenarios. So as soon as the next over the next 3 to 4 years, global inequality could start increasing. it could be much more evident by using the more optimistic scenario, but still under the less optimistic or pessimistic scenario of growth, inequality will start to increase again in the coming years. So by the mid to late 20s, we could observe this reversal. The emergence, what we observe when we disaggregate, for instance, excluding these large economies such as China, India, or China and India together, what we observe is that the emergence of the boomerang is greatly driven by China, not India necessarily. It's driven mainly by China and other large emerging economies. If you look, for instance, at the red light, when we are excluding China from the computation, so there is no boomerang there. When we put back China, but then we exclude India, what we observe in the dotted line is that the emergence of the boomerang remains, and it's running in parallel to the estimation for the whole set of countries, right? So, and when we exclude China and India, inequality is following an increasing path. This is the gray line. So this is telling us that it is China and other large emerging economies, such as perhaps Indonesia, Nigeria, Brazil, etc. Right? But it is not necessarily India. And an important issue is that inequality during the pandemic increased in 2020 when China is excluded. So this is telling us that the pandemic indeed dropped the world apart when we consider when we are not consider China, which, by the way, was one of the very few economies that experienced growth despite of the almost generalized contraction in the world. So this is the received narrative. Just to conclude, we argue this alternative narrative that the sunshine narrative of a much better world in terms of monetary equality or less monetary inequality has been rather perhaps oversold, and that we should temper that and perhaps expect a potential increase in inequality, which could be telling us that if inequality between countries is about to start increasing again, then there is some space for policies within countries to start reducing the within country component and therefore try to counteract this potential reversal. Thank you very much.
Thank you very much from me too. We're very grateful for the invitation to present our work. If there are any questions or comments, of course, sorry we can't be with you, but we're very happy for you to contact us at our King's College London emails, or indeed if an opportunity arises to talk over Zoom or Teams. Thank you very much again, Terima kasih, and good luck and all the best for the workshop, the conference. Thank you very much. Goodbye.
Okay, that's the opening remarks from Professor Sumner and Dr. Eduardo Ortiz for the second plenary session. And we inform you, for all participants who interest and want to respond, the keynote speaker that has been delivered by Professor Sumner and Dr. Eduardo Ortiz, we could collaborate it in the second plenary session that we've been waiting for. Okay, ladies and gentlemen, until our next session, we will have the second plenary session that we've been waiting for, with the topic discussion, post-pandemic, the policy option for inclusive economic recovery. Therefore, I would like to invite our three prominent speakers to come up to the stage and sit on the designated chairs. Ladies and gentlemen, please welcome our speakers. First is we have Professor In Ho-koo. He is a professor at the Department of Social Welfare from Seoul National University, South Korea. And next we have Ms. Aruch Wahid Dar. She is a lecturer of Economic and Research Fellow at the Institute of Business Administration, or IBA, Karachi, Pakistan. And then next we have Professor Arif Ansari Yusuf. He is known as Professor of Economic at Padjajaran University, Indonesia. Let's give a round of applause to our speakers. Yeah, and as usual, the session will also be led by a chair and discussion who will guide us throughout the whole forum and discourses on this topic. So without further ado, let's give a round of applause to our chairs, Mr. Setio Budiantoro from the Indonesian SDGs National Secretariat, and Dr. Elan Satriawan from the Indonesian National Team for the Acceleration of Poverty Reduction, or TNP2K. And we also inform you to the online participants could participate to in our Zoom. Yeah, and then we're gonna show up your video and unmute your microphone when the discussion start. Okay, and then ladies and gentlemen, I will hand over this session until 3:30 p.m. to the Honorable Chair, Mr. Setio and Dr. Elan. The stage is yours.
Okay, thank you so much. I think today we have really lucky because so many discussion that very insightful, and even also that the speech that from Professor Andi Samer and colleagues, I think is quite also provoking to us, and for the second session, this is quite challenging for the speaker because we will discuss, we already talking about a challenge this morning. And then for now, we are now discussing about policy option for inclusive and sustainable economic recovery. Actually, when I read from Professor Inhoku, that I read from the book. And so for this session, so we are lucky today that we have expert for this. The first speaker will be Professor Inhoku, that coming from Department of Social Welfare of Seoul National University, and his expertise especially for poverty, inequality, and social policy. So it's really appropriate for this, and he will launch his book entitled Poverty and Inequality in East Asia. So we are looking forward for the book, Professor. And then the second one, Professor Arif Ansari Yusuf, Professor of Economic at Padjajaran University, Indonesia. So Professor Arif Ansari also affiliates to many universities like King College, and then also Crawford School in INU, and also in UNU wider, and also he also published many research related inequality, and also expertise in modeling in CCA. And then Aroj Wahid, the lecturer of economics and research fellow at the Institute of Business Administration in Karachi, and I think her research includes human development, inclusivity, and equality. So it's really really appropriate for this. And in here also we have a discussion. Dr. Elan Satriawan from the national team for acceleration of poverty reduction of Indonesia. So in the vice president so in Indonesia. So this is we are lucky to have all of them of the speakers. So for the first speaker will be Professor Inhoku. Please, Professor, for 15 minutes. Thank you.
Okay, thank you. Okay, I will first talk about inequality during the pandemic in South Korea, and then move to the
move to the discussion about social policy responses in South Korea and some discussions about that. Next, please. Yeah. In the morning sessions, I found many commonalities, but still a little bit shocking differences between Asian countries. Basically, I'm talking about the inequality during the pandemic in South Korea, and actually, I found that the pandemic does not affect inequality significantly. So there is a large differences here. Basically, South Korea has managed to contain the spread of viruses very successfully. So you can see that the number of cumulative confirmed cases and confirmed deaths are very below the average across the world. And this leads to a less significant economic loss. For example, you can see that while the global economy contracted by 3.5% in 2020, the Korean economy just shows a just about -1% decline. And then into 2021, it recovered to 4.9%. So the economy was not severely affected by the pandemic. In addition to that, the government directly distributed benefits to people and firms, which amounted to 6.4% of the GDP in 2020, which is not large in comparative terms, but which is also very unprecedented in Korea. That's a history. If you look at the history, it's a big money in South Korea. One of the features I will talk about the spending. Korea relied on I'm called it one-off emergency subsidies on an ad hoc basis. They do not expand the regular social safety net. They just newly introduced some emergency support measures. Okay, next, please. So next to few tables show the effect of the pandemic on income inequality. The first one shows that basically these tables are based on the national surveys conducted by the Statistics Korea. And this one shows the growth rate of household income. The first one shows that the growth of market income was 1.24 in 2020, which is less than the previous growth rate, but it's just not that bad. And if you see the government support, it's amazingly highly grew. In 2020, the public transfer income has increased 35% compared to the 2019, and it was even larger than the previous years. Actually, during that years, the progressive government expanded a lot of social transfer measures. So finally, the growth rate of disposable income was 3.4 in 2020, which is much larger than the previous one. So people enjoyed some growth of disposable income. I mean, on average, not all of them, on average. So next, please. This one shows distributions of income, and actually the first panel shows distribution of market income, and the next one shows distribution of disposable income. So you can see that the blue line shows that the poverty rate of market income slowly, gradually increased for the last few years. and Gini coefficient is just to stay stagnated. So the poverty rate was the poverty rate of market income was over 20%, and the Gini coefficient was about 0.4. This is basically a market income. And the next panel shows that despite of the growth of some inequality and poverty of market income, disposable income, its distribution was improved for the last few years. So the poverty rates went down and Gini coefficient went down if we measure those indices based on disposable income, because of the some increase in government support. Okay, next please. Actually, we in South Korea, we are measuring poverty based on the concept of relative poverty, which is whose cutoff is the 50% of national median income. So I'm trying to more precisely assess the effect of pandemic after considering the previous trend in the distribution, because in South Korea the poverty rate and inequality went down for the last few years. If we consider the declining rate, what will happen? And I see that just to look at the disposable income part, and the recent years, the poverty rate was declining at 2.55% at annual rate, and during the pandemic, it declined to 6.1%. So the poverty rate was more declined than the previous trend. Okay, next please. So this is the summary. The first one, the pandemic deteriorated the distribution of market income, and especially adverse effects was concentrated on the self-employed, low-skilled workers caring for children, because they are usually work in the occupations which requires in-person services. So remote work is not an option for them. And there are relatively long school closure times, and that increased the care burden of mothers. Also, government subsidies improved the distribution of disposable income. And this one is basically a short-term assessment of the pandemic. If you look at the long-term prospects, it may be different. Because, I usually told that Korea reformed its society during the past 30 years. It was in the early 1990s. It was more like equal European societies. But nowadays, it's very close to very unequal USA. Only during the 30 years, the change completely reformed its systems. And the most important reason is that job polarization in the labor market, which means that in the labor market, there are a small number of very good jobs on one side, and the other side, there are very growing number of loud jobs, very insecure jobs. And the pandemic accelerated that kind of job polarization in Korea. And in addition to that, education gap among children and career disruptions among women were very worsened during the pandemic. So that kind of factors make us to forecast a very bleak long-term prospects of the after the pandemic era. Next, please. I will talk about more detail about the social policy responses. You can see that the picture shows that Korea, actually this one is coming from the IMF report, and the first bar shows additional social support for people and families and firms. The next bar shows the loan to businesses. So the first bar is very important to household members, and Korea, the Korean government spent about 6% of GDP on additional spending for families, which is not large to compared to other high-income countries. Next, please. And the more important point is that the composition of programs. You can see the many Western welfare states focused on the first three components. The first one is job retention subsidies. The next one is unemployment insurance. And the third one is social assistance program. All of them expanded that kind of regular social protection measures. But in Korea, the government didn't expand any at all about the existing social welfare measures, but they just newly introduced some emergency support program. The three kinds of support program I will talk about later. Next, please. This one is job retention subsidies, and many OECD. You can see in the middle of the you can see the Korea there, and many OECD countries spent a lot of monies on jobs retention subsidies. So even if the employer didn't need their employed workers, they didn't fire. They just get the wage subsidies from the government and to keep the employees. But Korea a little bit tried to expand it, but it's almost close to near. The next, please. This one is unemployment beneficiaries. Korea shows some moderate increase of unemployment insurance beneficiaries, about 20%. But many countries shows a lot more spending on the unemployment insurance. Next, please. This one is paid sick leave policies during the pandemic. You can see many Western countries shows 100% of use of paid sick leaves, but in the end, Korea shows a relatively small increase of paid sick leave. So if you are sick, due to the virus, you cannot take leave because the government does not provide any statutory sick leave policies. So your destiny just depends on the employee's decision. Okay, next, please.
Sorry, 2 minutes more, Professor, 2 minutes.
Okay,
yeah.
Okay. This one is the most important policy tools taken in by the Korean government. They use one-time emergency subsidies very repeatedly. For example, if we had the first wave of virus spread, the government decided to distribute one-time support money. That kind of ways, the government provided emergency subsidies 5 times in the 2 years, because they don't want to get established the very regular social welfare system distributed to large population. Next, please. Okay, so nowadays the government are considering some kind of policy measures. The first one is they want the internal revenue service expanded a real-time information system to collect monthly information of all the workers to provide some kind of emergency or not emergency subsidies. The next one is they tried to introduce unemployment assistance program and try to expand the coverage of regular unemployment insurance programs, especially to the dependent self-employed workers. The third one is they tried to implement a pilot project of a paid sick leave program. Next, please. Yeah, this one is the almost last one. But for the last 30 years, we found that we don't have a very effective social policy measures without economy providing very good jobs. Social policy measures cannot properly work without good jobs. But for the last 30 years, the job polarization was very, very serious. And as I told you, the pandemic wasn't the situation. So we need some good policy measures for creating good jobs, such as active labor market policies, minimum wages, and collective bargaining. Also, we need some taxation because for the last few decades, taxation was gradually shifted from capital to labor, and excessive labor income taxation creates some incentivize businesses to take labor substituting, so job reducing technologies. Next, please. Yeah, we also need educational opportunity program and gender equality program. Thank you.
Thank you, Professor. So many good insight, I think, that we learned. So we learned from Korea, the advanced country, that related to the COVID, the impact of the COVID actually relatively handled quite well compared to other countries. But for the future, related inequality for the future, related job polarization, and also how to transition for the digital and also for the green economy. That is when I read the Korea new Green Deal, I think is quite really good, and we should learn about that. Thank you, Professor. Now, Professor Arif, your turn, please.
Thank you, Mas Setio. I don't have slides. First of all, because one of the reason is the topic that actually I personally propose is on the future, the prognosis, the policy option for recovery, which we haven't had it yet. And it's not part of the chapter that we wrote in the book. So I decided not to have slides. But before going into that, I may share a little bit about what the book, but what will be in the book. But I suggest strongly that you guys read, because it will be clearer. But let me, in 2 minutes or so, summarize the chapter on Indonesia. If you listen to Andy, Summer, and Eduardo keynote, you see the trend in 1990s and toward 2000s of declining global inequality, right? But the driver of that growth is mainly China. China catching up with the Mickey Mouse. Panda Mickey Mouse. However, when you look at by regions, and region that is the topic of this book, Asia, the story is a little bit different. There are many reports, including one of the most important one is from ADB in around 2000 something, which report that actually inequality in Asia during the same period that Andy mentioned actually increasing. So before the pandemic, Asia and also many countries in Asia actually are in the midst of unprecedented high inequality, especially in Indonesia. And then the COVID hit. In the book chapter that we and Professor Susi wrote, we defined 3 options of recovery, 3 future likelihood of recovery. First, what we call pre-pandemic full recovery trajectory, which is the inequality after the recovery will be at least the same as inequality before the COVID. That's at least, I mean, that's conservative. So COVID increased inequality, but the recovery will recover it. So we have the same level inequality, so COVID. That's the first likelihood. The second likelihood is the one that is promoted by many organizations, international institutions like World Bank, or sorry, UN, which called Build Back Better recovery. Build Back Better recovery mean we use this COVID, this crisis, as an opportunity to improve even to the level before the COVID. So the recovery will be a momentum for us to improve. So it will end up with inequality, with equality better than COVID by engineering our recovery better. So that's Build Back Better recovery. Yet there is other one, the third one, which we call destructive recovery. Destructive recovery is a recovery in which the recovery itself actually increase the gap between the rich and the poor. Not the COVID. The COVID already passed history. There's consensus almost that it increased poverty everywhere because that's already the data show, but recovery not yet. Now, the destructive recovery is the recovery that for some reason, one way or another, end up we even in income gap that is higher than COVID. And then the chapter analyze the possibility and end up with the conclusion that this last one that I mentioned is the most likely for Indonesia. And the data show that, for example, just 2. Otherwise, I will talk about this too much. If we look at the region in Indonesia that is hardest hit with the COVID, Jakarta, for example, inequality rise 8% level only in 3 years, which is normally in 3 decades. And other 2. My colleague from Korea mentioned that there is no growth without good job. Yes, that's what happened too. Economic growth in Indonesia recently increased by 5.7% year on year compared to the quarter last year. However, during the COVID pandemic, formality, which is good jobs, right? Formality, formal work is good job. Informal job is not necessary, is typically bad job, I may say. During COVID, good job, formal job, declined by 5%. That's a lot. That's in 2020. Now, 2022, 3 years later, 2 years later, still the same. Still the same. Not even move a bit, it's barely move. So the recovery, that's why we concluded if growth increase, you don't provide good jobs to people, then it most likely increase inequality. Okay, so that's the story of the chapter. Now, the second part of my intervention will be the topic of this session, policy options. So this will be less formal because this is futuristic, forward looking. So I will just thought sharing about my. First of all, I think we should acknowledge and understand the urgency because not everyone does. Not everyone does. Government in Indonesia, and I'm sure in many other countries, in the democracy which is weakened by populism, tend to overstate success and understate failure. And that's risky. For example, we are celebrating too much economic growth without looking at formality, for example. And then, but this overstatement or understatement of failure sometimes is not intentional. Sometimes because we are rely too much on certain indicator that we love so much, but neglecting others. We are pretty much obsessed with economic growth, for example, but even in inequality context, we too sometimes ignorant about its weakness. In Indonesia, for example, this is what we wrote in the book too, that Indonesian headline Gini coefficient is measured by consumption. During COVID, consumption of the rich fall much more than consumption of the poor. Why? Because they cannot go out, they cannot go abroad. They save a lot, they reduce the consumption. But the poor, if they stop consumption, they're dead. They cannot eat. So that's why Gini coefficient of Indonesia will move a little bit during COVID because of that reason. Our experience, my recent experience of traveling overseas, which is difficult to get visa, ticket price high, that's exactly the situation where suddenly people rich people suddenly want to go out, want to go somewhere. So that's a weakness of statistics. Sometimes make us overstate something. So how to avoid this non-acknowledgement of urgency and little understanding of urgency? I think one of them is through this event. So we have to improve partnership more with academia. So we are sharp all the time, discuss with people in academy and also with CSO, civil society organization, to keep us stand on the ground. Yeah, so that's too is important to make it. Next is, okay, then how about the mitigation of future risks of the inequality? So I think one of them is we have to understand more about the difference between what factor which is underlying factor, which factor which is immediate factors. But we also understand that two underlying immediate factor can interact in one way or another that make a situation a little bit different to comprehend. I just give you an example. A lockdown sometimes is blamed to be the factor that increase inequality, the lockdown or mobility restrictions, right? But that is a immediate factor. There are other structural factors that if combined with lockdown, which is I call comorbidity of COVID, which actually that's combination of the interaction of this immediate factor with underlying factor make the things worse. So if you have high informality, if you have urbanization, which is high, then you ask people to lock down, then inequality will rise because not everyone can. The people who has daily job and daily wage cannot be restricted their mobility. So that's the same story, I think, what I read from other chapters in it. And the underlying cause, which is that urbanization, structural change, that has been since long ago before COVID. So that's structural. So we have to understand what's going on. And then other structural factor, for example, is technology. I think some of you mentioned. If you read economics or economic development in particular, we tend to like certain factor that can cause inequality. Most economists agree, which is technology. Technology is most economists agree actually. Technology is factor that behind it.
Sorry, 3 minutes, yeah, Professor.
Okay. Why technology? Because long ago we have skill bias technology that create inequality. But nowadays we have routine bias technology. People like routinization, geopolarization. So that people quite nervous that COVID-19 actually accelerate this technological change. And this technological change actually make what happened in Malaysia that I heard before, in Korea, or now in Indonesia, that acceleration was driven by COVID-19. So that's why people don't come back to their old jobs. So that's also structural factor. Now, okay, last 1 minute will be the immediate short run policy option. Another 2 minutes will be one long run. So the short run, I think I want to restate my colleague from Korea that recovery or growth should bring back good job. I have here, just in case I copy him. No, I have here too. Recovery should bring back good job. What matters is quality growth, not just growth per se. And then how? Now this is the question. How? I think we cannot avoid it. At least in short-term period, we have to have temporary support for labor-intensive sector. It's difficult to say for me. It's difficult to say, but I think that's necessary. Maybe you not agree. And then of course we have to have the poor to cope with food price. That's short-term. Yeah. And the commodity price actually get some people benefit. I think we should share the windfall from this commodity price in Indonesia to others with taxation, for example. And then also don't attempt to make policy that may worsen the problem. For example, protectionism. That can even increase the price of food. And of course, improving accuracy of social protection is necessary. Okay, now last, what about long run? For me, I think in Indonesia, we have very low tax ratio. But so the agenda is increasing tax ratio, so we have more fiscal space. Yet, I haven't heard any discussions on if we have that higher tax ratio, how will we gonna use it? We haven't heard the discussion about that. I think that should be a socially progressive budget commitment. So that's long run. And then of course we have to prepare labor force for new technologies, yeah, to avoid job polarization and so on. And then this is last, we should prepare our cities infrastructure. Why? Because Indonesia is now 60% urbanized. In 2030 will be 70% urbanized. I think in Asia juga, in other Asian country. So we have to have smart and inclusive cities. And why I put it on the end? Because this is the area I think that we have complementarity between social and environmental goals. Because environmental problem in cities is quite high, a lot. People, livelihood of people in the city are very low. Most of them related to environment, and the solution related to environment too. For example, public transport, yeah, and so on. And that is complementary into environmental agenda, including climate change. And this area is where developed countries can also help. So I think that's end my. But last, sorry, hope. What about hope? Last one. I want to quote a book that I read, yes, recently by Piketty, A Brief History of Equality. Because I'm worried that you think too much, that I'm too pessimistic. But let me read it out loud. Human societies constantly invent rules and institutions in order to structure themselves to divide up wealth and power, but always on the basis of reversible political choice. So we can do something. Thank you.
Thank you, Professor Arif. Many provoking ideas, I think. So related to the option, of course, we need to build back better. That is the policy option that we should pursue. And Professor Arif also provide some options related to what also this morning we discussed related progressive taxation, and also this one for the social progressive fiscal policy, and related to also technology, and related to the sustainability that we are now really worrying about climate change and everything. So Okay, thank you, Professor. And then now we go to Aroj Wahid. Please, 15 minutes.
Hello, everyone. So the problem with being the last speaker is that all the points have already been covered. So there's very little for me to add, but I'll briefly walk you through the impact of COVID-19 on Pakistan, and I'll focus more on the solutions. So next slide, please. So I divided my analysis into 5 main sections. And the first section was the unequal access to opportunities, because I personally felt in our analysis that the exacerbation of inequalities was largely led due to the unequal access to opportunities. Next slide, please. And when we say unequal access to opportunities, we focus on access to technology, the impact on youth, access to education, access to health facilities, and vaccine distribution and administration. Next slide, please. So when COVID-19 hit, we all know that there was this phase of rapid digitization. Everything went online overnight. Now that was very helpful for a lot of us, but in a country like Pakistan, where there is very skewed distribution of income and wealth, many few people are able to afford digital devices, and very few people have access to internet. Now you can see over here that internet access is limited to only 23% of rural Pakistan and 47% in urban Pakistan. And of this, 76% of the entire internet access is only limited to 4 major cities. Smartphones are owned by a lot of people, but within households, these smartphones are majorly owned by the head of the family. So the women in the family and the children in the family are isolated from work and educational opportunities. Next slide, please. So we theorized that this non-access to internet and digital devices led to very skewed distribution of access to work and education. Next slide, please. We also saw that there was a very unequal impact on youth. So the youth was severely disadvantaged during this time because of lockdowns and the initial period where there was a lot of business closures. The young people were generally the first ones that were let go from work. So we saw a spike in the number of jobless graduates in Pakistan. Next slide, please. Coming to the access to education, there was a widening of the knowledge gap between the richer segments and the poorer segments. And this was largely due to the fact that when schools closed down, schools had to go online. Now, in Pakistan, there are private schools and public schools. Private schools are generally attended by the more wealthier segments, while the public schools are attended by the more poorer segments. Now, when things went online, while a handful of private schools were able to digitize and offer online classes, the public sector was completely isolated from these opportunities. And now the only option left for them was to study at home. Now, these poorer households, the mother is not very well educated, and therefore she was not able to teach the children as well as they could have learned in school. So we theorized that there was a widening of the knowledge gap due to these factors. Next slide, please. Then we talk about the access to health facilities. Now, when the pandemic hit, Pakistan was caught completely unprepared. The healthcare sector was very constrained in its ability to deal with anything of such devastating proportions. So we faced a severe deficiency of quarantine centers, testing kits, diagnostic facilities, drugs, and equipment needed for treatment. And while the rich were able to afford access to private healthcare, the poor segment had to rely on public health service, and they had to struggle over securing spots in designated healthcare centers. And also the loss of income and jobs during these lockdowns exacerbated the situation because there's very little universal healthcare in Pakistan. Next slide, please. Now, in terms of vaccine distribution and administration, Pakistan fared really well in terms of that. By August 2020, Pakistan was able to acquire a lot of vaccines from China and under the COVAX program. And by June 2021, Pakistan was able to manufacture and bottle its own single-dose vaccine of COVID-19. But, next slide, please. The main challenge for Pakistan's government laid in terms of convincing people to get themselves vaccinated, because there were a lot of misperceptions on the social media that was stemming from basically the fact, from the ideas that vaccines can cause infertility, that the pandemic is a foreign conspiracy, and that the virus is completely harmless. Next slide, please. So in our next section, we focused on gender inequalities, and we focused on health and survival, economic participation, and education. Next slide, please. So as you can see over here, over the years from 2018 to 2020, the gender gap in Pakistan, rather than improving, it has remained steady or worsened. And the reasons for that, we're going to highlight in the coming sections. Next slide, please. So in terms of health and survival, as I already told you, that Pakistan was caught completely unprepared. So a few resources had to be designated towards dealing with the pandemic. So reproductive, antenatal, and other health facilities, which are particular to women, were heavily compromised because of the mounting pressure of the pandemic. Midwives, vaccinators, and family health workers were not able to provide their services due to the SOPs that were in place. And as a result, around 17 million children, they missed out on their routine immunizations. And there was a 30% decrease in family planning, 19% decrease in skilled attendance at birth, 10% decrease in newborn healthcare, and 26% decrease in vaccine coverage. Next, please. Now, when we talk about health, it is very important to talk about mental health as well. Now, in Pakistan, under the mounting pressure of the pandemic, when lockdowns were imposed, people were confined to their homes. And this confinement was also coupled with loss of jobs and loss of incomes. So during this time, we saw an increase in terms of gender-based violence. The number of reported cases surged by a lot, and we fear that the unreported cases may have been even more. Next, please. In terms of economic participation, women were hindered to participate economically because of the burden of unpaid care work. Because of school closures and lockdowns, the demand for unpaid care work increased by a lot. Now, in Pakistan, 80.5% of economically inactive women were out of the workforce due to unpaid care responsibility. Of the women that are economically active, 94% are employed in the informal sector. Now, in the informal sector, there's very little job security. And so we fear that when lockdowns were placed, these women had to bear the brunt of income and job losses. Next, please. We also saw that the pandemic has impacted the education sector more adversely than the others. And this was because when schools were initially shut down, a lot of them never reopened. Now, the education sector is the largest employer of women, with nearly 54% of teachers at secondary level and 72% of teachers at lower secondary level being female. Next, please. So at the time of lockdowns, around 26 million students dropped out of school. Out of these, 50% of the children never came back to school, and of these, 60% are female. So the learning losses are expected to be much higher for females who are not going back to school and who do not have access to any digital devices at home. Next, please. Next, we focus on income inequality and food security. So income inequalities were also widened during the time of the pandemic, because during the lockdowns, a lot of the businesses, they faced closure, rendering their employees jobless. And so during 2020, the poverty in Pakistan increased from 4.4% to 5.4%, below the poverty line of $1.9 per day. And an estimated 126 million people are likely to have been pushed into multidimensional poverty in Pakistan. Next, please. Now, although this this job loss was short-lived because working population deteriorated from 35% to 22%, but this was only applicable during the time of the lockdown. Now, 50% of the working population had to either suffer from job loss or a reduction in income, and 74% of these belonged to the informal sector. 27.3% did not get any income during this period. Next slide, please. Now, although there was a lot of job loss, this economic downturn was short-lived because Pakistan demonstrated a V-shaped recovery within a few months after the lockdowns were removed. So the working population jumped back at 33% post-lockdowns in August the same year. And the unemployment rate stood at 6.9% in 2018, but it fell to 6.3% post-pandemic. Next. Next, please. Now, the other thing that happened during the same time was, at one hand, there was decrease in incomes, there was job loss going on, and on the other hand, there was a spike in the food prices. So there was a lot of increase in food insecurity in Pakistan. During lockdowns, the mounting food prices, in conjunction with the loss of incomes, raised alarm for rising food insecurity in Pakistan. 50% of Pakistani households had to switch to lower quality food, or they had to decrease the quantity of food that they consume. 60% households were unable to eat healthy and nutritious food, and severe food insecurity increased from 3% to 10% after lockdowns. Next, please. Coming to wealth inequalities. Next, please. Now, the time of the COVID was such that it gave the government a chance to act in a very authoritarian manner, because whatever policy they'd come up with, there was very little room to question them, because whatever policy they had, it had to be implemented immediately. That, in conjunction with rising income inequalities, resulted in a case where there was increasing corruption, and the rich and the powerful engaged in unethical practices to try to maintain their status. So there was increased incidence of sellers charging exorbitant prices for essential food items, health supplies, and medicine, because they were trying to take advantage of the panic buying at the start of the pandemic.
Sorry, 3 minutes more. Thank you.
And there were allegations of rewarding cronies, offering contracts without tenders, and overpricing of medicines. Now, although they were offered as subsidy to utility stores on essential food items, the effect of this was lost because of the regressive tax policy. And although an incentive package was offered for the construction industry, there's the allegation that this was basically done to favor a few richer segments of the population. Next, please. Now, in terms of sectors, the service sector of Pakistan was worst impacted, followed by manufacturing and then agriculture. Next, please. And impact on household health was the worst for the poorer segments of the society, where 47% of the households had to use of their savings. They had to either sell properties or to borrow loans. 1/3 of the households were forced to borrow money from friends and relatives. 12% households had to delay repayments of loan that they had procured before the pandemic. And many of the poorest households were forced to sell their most productive asset, usually in the form of livestock. Next. And it's not possible to talk about Pakistan without also having talked about the environment, because Pakistan is, in recent times, it has faced a number of unprecedented natural calamities. So these rising temperatures, water scarcity, rising sea levels, these are all causing major problems for Pakistan. So the increased incidence of these events greatly inhibited access to healthcare facilities, especially for the poor segments of the nation, making them more vulnerable to the pandemic. Also, the locust attacks during 2019 to 20 exacerbated food insecurity during the time of the pandemic. Next, please. So the COVID-19 also created the need for a lot of disposable paraphernalia like face masks, etc. So thereby it increased the use of plastics. Without proper disposal, we fear that this may have adversely affected the environment. And also there was a shift in the priority of the government from tackling climate change towards tackling towards tackling the pandemic. Next, please. However, because of the lockdowns, we saw that there was very evident improvement in the air quality index. These are the 5 major cities of Pakistan. And we saw that there was very evident reduction in the level of toxic gases. And this was largely due to the fact that during lockdowns, there was reduced demand for public transportation. And also there was reduced demand for electricity because offices were shut down. Next, please. So talking about the way forward, next, please. Now, television is the main digital device that is most ubiquitous in Pakistan. So we argue that in order for to have inclusive outreach in terms of education, you need to have a television mode of education. But the problem remains that there's very little monitoring and assessment, and that reduces the efficacy of the program. Now, during COVID, Pakistan did introduce a tele-school, but the problems with it were that it was only offered in 2 languages, Urdu and English. But in Pakistan, where there are a number of indigenous communities that speak local languages, these children were cut off from these educational opportunities, making the marginalized communities more disadvantaged in terms of education. And okay, so cash transfers were also offered during the pandemic. And we believe that it did sort of mitigate the situation to a huge extent. But the problem was that these were one-off payments. And for continued efficacy, you need to have regular cash transfers. Next, we propose that there needs to be an inheritance tax in place, and taxation policies need to be made more progressive in nature. Now, the problem with Pakistan is that the rich and the powerful are in the government who do not want either inheritance tax or progressive taxation policies. So that is the largest barrier that Pakistan needs to overcome right now. Also, the formalization of the undocumented economy is necessary to ensure job security. Now, the problem is that Pakistan has tried to document the economy, but the focus has always been to try to bring people into the tax net so they can be taxed. So the shift in priorities needed. They need to facilitate people, they need to facilitate and give chances for innovation and entrepreneurship so that more and more people become documented. There's also a need to incentivize work from home policies. This is needed because a lot of women are unable to access work opportunities because they do not feel safe going out. There's lack of safe public transportation, and this immobility is basically the reason which is keeping them away from pursuing economic participation. So we say in our paper, we propose that there's a need to incentivize work from home policies, and also this is needed so that there can be a reduction in the toxic gas emissions in Pakistan. Then we say that we need to capitalize on this significant youth bulge by providing opportunities for innovation and entrepreneurship. And we say that the new SME policy in this regard is a step in the right direction, because under the new SME policy, loans are available at very low interest rates. And also women are given more facilities in terms of getting the loans. And we also say that there is a need to provide indiscriminate digital infrastructure so that everyone can have equal access to online work and educational opportunities. That's all. Thank you.
Thank you, Arot. I think it's really, despite of very limited time, but you clearly show very vividly related the challenge that happen in Pakistan related to great digital divide, jobless graduate, and many things related to inequality of health, education, mental health, and then gender. And also for the way forward that actually in line also with what we are discussed in this second session. And now the turn for Pak Elan. So I think you already write. I see that you already write a lot. Probably you you can respond.
I pretend to be busy.
Oh, okay, okay, please, please.
Okay, thank you, Mas Budi.
So yeah, good afternoon, everybody. And when Professor Wahid actually told us that it is very challenging to serve as the last speaker, that's even make me more nervous. So because my turn is actually come after her. So and it's even more challenging because I need to comment on the 3 excellent presentation in a very short period. And to be frankly, this is my first time actually to listen to the presentation of these 3 excellent presenters. But I'll try my best. And I think I learned a lot from this 3 presentation from Professor Ku, Professor Arif, and Professor Wahid about the experience from each country, Korea, Indonesia, and Pakistan, where of course there are many similarities between Indonesia and particularly in terms of the problems, the type and the magnitude of the problem. I think we're close more to the Pakistan, but I think also we can still learn a lot from what Korea has been doing. I'd like perhaps to focus more, since this is the session about the policy option. So I'd like to focus my comments on the policy options, and what perhaps also at the end of my comments, what Indonesia actually can do better. So I think it's I try to summarize what Professor Ku mentioned, that and that makes similarities to what there are some similarities to what we're doing in what we have been doing in Indonesia, as well as also to Pakistan. I think first is data is the first important thing to make the right policy, to make the response policy is effective. And I think what Professor Ku told us, Korea is very fortunate. They have like the income data collected on the regular basis through their IRS, the Internal Revenue Office, and that's basically like the best, perhaps one of the best, if not few the best, of the measurement of the welfare. We're in Indonesia, and I'm sure also perhaps in Pakistan, a country where the labor market dominated by the informal sector workers. We don't have such luxury. That is why, as Professor Arif said, we in Indonesia rely on the consumption when it comes to measure the poverty, the inequality. Even for our targeting data, we even use the proxy mean test. Yeah, because we cannot, even for the consumption, we cannot collect the consumption, because Indonesia is a country with like 200 close to 270 million. So it's not possible, to collect to interview for each household the consumption module that perhaps takes about 3 hours. So we collect like more indicators that can proxy the means. Yeah, and that's what we've been doing during the pandemic. Although that database actually has been built since 2010. But I think that's the first lesson that I'd like to take a note from the Professor Ku presentation, and that's actually at the first priority, that if we should learn something about how to make the right policy, how to target better during the pandemic, it is the data. The second thing is on the perhaps Korea and as well as Pakistan. I think comes with the
it's a combination between the regular program and then the new program. Yeah. Pakistan also, as Professor Wahid said, launch the cash transfer, the regular one and then one-off. Yeah, and I think that's the right thing to do, and that's also I think what Indonesia also been doing at the very beginning when the pandemic actually hit Indonesia. Why? Because timing in this pandemic to respond to the pandemic, it's very urgent. It's very important. We may not have like the protection for all those that affected by the pandemic, but I think the lesson learned from many countries, and we heard I think very well from Korea experience and Pakistan experience, a government use the existing means, the existing measure. So what we have, the policy and the data, that's what we should use at the first place, and then immediately after that, expand the program, introduce the new program, and improve the data. And that's I think what Indonesia also doing too during the pandemic. First, we launched the regular program, and with that we expand the regular program to cover better the new poor, the new vulnerables household, and we introduce as well the new programs. Yeah, I think Korea has like a business incentive. Indonesia also have like a bantuan produktif usaha mikro, so micro enterprise productive assistance. Yeah, that didn't exist during the pre-pandemic. Yeah. As well as the wage subsidy. Yeah. And so that's actually the third lesson. The second lesson. The third lesson is, and this is perhaps not yet exists in the particularly Indonesia, but I believe also in other developing middle income countries, is on the adaptive social protection. Yeah. So a system that readily respond immediately when the economy actually face the shocks. So it could be like the health shock, the pandemic, like what we have with the pandemic. It could be also like the economic crisis shock. It could be like a natural disaster, and including the climate change. So a social protection system that can be like as much as to be responsive actually to different kind of shock. So the government is not need to discuss and then prepare the budget. So definitely it will take time, and then by the time the program ready is to be launched, the poverty already increased and inequality already increased and so on. The fourth one, last but not least, is beyond the social protection, the data, the program, the adaptive social protection. So I'd like also to mention about the supply side, and I think this is mentioned also particularly by Professor Wahid, that we're in the developing countries, in the middle income countries, we're still facing while we strengthen the demand side, while we strengthen the poor and then the vulnerables with the different program with different assistance, but it won't be so effective if the supply side is not ready. And that really that's also quite relevant when we look back to the experience during the pandemic. So government basically paid for the insurance for many millions of the new poor, new vulnerables. But if the health facilities, if the is not there, if the doctor is not there, if the vaccine is not there, if the equipment is not there, so they cannot basically use the facilities from the government. Same thing happened for the education. So you give the scholarship, but it won't be effective if the school is not there, if the teacher is not there. So I think that's that's something that I think the four notes from the three excellent presentation. And I think last about the measurements, what Professor Arif said, that the consumption is definitely is not the ideal measure. It's understate the underreported, the underestimate the poverty as well as the inequality, where Indonesia also been discussing about not just the measurement but also the poverty line itself. But again, I think it's at the same time, you know, that it's impossible, it's almost impossible to use and to collect the income data. Yeah, when the labor market, the 55 to 60% of the Indonesia labor market consists of the informal sectors. So far we perhaps just rely on the consumption based measurement, but we perhaps now need to use the multiple. One is to improve the methodology of the poverty line. Second is actually to use the multiple threshold of the poverty. So right now Indonesia poverty line equivalent perhaps to 2.5. We may want to also to use a 3.2 just to look how big actually the vulnerable household that's still close to the poverty line and so on. Yeah. So so for the economy, of course, to provide the good jobs is technology is matters, but also provide the good job as well as prepare the labor for and reduce the informalization, yeah, or improve the formalization is another agenda for Indonesia, and I believe for other middle income country as well. So I stop there my comments. Thank you.
Okay. Thank you, Pak Elan. I think yeah, it's really interesting related to some agendas that highlighted by Pak Elan. And now we go to the for the question session. And from the chat of Zoom, actually, there is a question. And this is actually for all of the speakers that this is the question is from Agus Suprapto from the Coordinating Ministry of Human Development Resources and Welfare. And as we understand that actually COVID pandemic not only affect the health of the people and also very broad. And is there any best practices or any good examples of the countries, probably not only our countries, let's say, but other countries that they are tackling pandemic and also achieving SDGs. So in your experience or knowledge that probably you already have in mind. And then for who want to ask, we have quite limited time, only about 25 minutes, but we still provide for 2 or 3 questions in here. Ada? Which? Oh yeah, sorry. Please introduce yourself and please.
Okay, thank you, moderator, for the chance. I'm Tania from CISD. Actually, this question is addressed to Mrs. Aruj. I apologize if I misspell the name. I already read about your research on the book, and I interest on the last statement on the part of the policy implications and action. on this statement mentioned about the way forward for Pakistan needs to be involve the greater youth representation. So my question is, how does the Pakistan government involve youth in efforts to achieve SDGs in the midst of a pandemic, especially to reduce the inequality social? And also seeing these conditions, what are the expectations of you as a speaker from the government and also the youth in Pakistan? Thank you.
Okay, so the problem is that there was not enough programs to support the youth, and that was exactly the problem why there was so much unequal or disproportionate impact on the youth. So the problem with Pakistan, I talked about the new SME policy, which provides loans to people, and in that process, you automatically get registered as well. And under that new SME policy, you get loans on very subsidized interest rates, and the process of getting the loans is also easier. So that I feel is one step towards giving the youth of the country a chance for entrepreneurship and innovation. The second way the youth was able to bounce back during the pandemic was that due to the heavy digitization, now it gave the youth it opened the world of online opportunities for the youth. So a lot of the young people were able to become freelancers or work for companies abroad. Now, I'm not exactly sure of the figure, but remittances in terms of revenue from IT in Pakistan increased by a lot because of the youth was engaged in a lot of online work for companies abroad. So within Pakistan, there are very limited opportunities for them. And that is why we believe that the main focus of the government should be providing opportunities to the youth. Otherwise, it will just become a burden on the economy rather than an opportunity.
Okay, thank you, Aruj. And then for the other question from Mr. Agus that actually Professor Ku and also Professor Arif and even also Pak Elan already mentioned about the option. Probably, is there any country that already doing what you propose, and can we learn from that like related to the green job and also related to the quality of growth that we expect? So please. Yeah, creating good jobs and also related to what you mentioned that now we have the digital challenge, digital disruption challenge. Is there any country that they already quite prepared related to that, please?
I'm not aware of very good practices or already implemented in any countries, but in my country, the previous government tried to, actually, we are talking about job polarization, but in South Korean case, the polarization is between regular secure employment and irregular temporary employment. So they are already formal, but the growing number of new jobs are created in the sector of temporary irregular jobs. So that's the problem. So the previous government is trying to reduce the number of irregular temporary jobs from the public sector. So they tried to convert the temporary public jobs into the regular permanent contract. But, it was not that successful. First of all, unexpected opponent coming from the youth they are seeking for new jobs. They feel that they lost their opportunities because the government trying to already those in the irregular jobs, they trying to convert to the permanent jobs. So newly employed youth have lost some opportunities. So it causes some political debate. And then basically the private sector did not respond to the government efforts in a positive way. They are very negative. So the government in the end almost stopped the policy. And then the new government is trying to reform the labor market into a more liberalized, flexible job market. So it may things more worse. So I'm not suggesting any good policy practices, but basically the starting point is that I think we need to secure some minimum wage policies, and we also need to strengthen some active labor market policies, especially for low-income, low-skilled persons. And then I think we need to enforce more broadly the collective bargaining practices in the labor market. That's a basic part of the solution. And also, you know, South Korea is the second to Singapore in adopting robots and automatic technology, automation, because the businesses just try to avoid any conflict with the labor unions. So just they don't want to employ more workers. So I think one of the solutions should be the government intervene to change the direction of the technological change, which is more friendly to employment and more promote cooperation between businesses and workers.
Thank you, Professor. Very clear. Prof. Arif, do you want to respond related to best practices that probably other countries already they made it?
Well, honestly, I don't have the answer to that. I'm not aware of any best practice about that, but I think during the COVID, best practice is everywhere, and not only in one or two countries, but I think in almost any country. One of them is that we realize that actually we can change if we are forced to do so, especially when during digitalization. You cannot imagine you teach Zoom every day and things like that, and then that not end there, because then will inspire other that look, if you can change like that during the COVID, then you can also change into green technology then, for example. So things like that. So I think that's the best practice of humanity COVID sometimes.
Well, I'm not sure whether, so let me just speak perhaps from the Indonesia experience, and then this is not necessarily the best practice, but we know that this is one of the current government programs that has a good impact on particularly on the skill and then employability of the workers, of the labor force. This is basically the new program called the program Prakerja, the pre-employment program that provide that initially actually like a combine the offline and then the offline. Well, initially even before the pandemic, it was designed before the pandemic. It was designed as mostly as the offline training, job training. But when it was about to be launched, the pandemic hit, and it is not possible to conduct the offline training. So it switched to the mostly the full online training, and I think this is the blessing in disguise, because if the training mostly or mainly delivered by the online, by the offline class, so it won't perhaps like be able to be reached by different regions, particularly those in the remote areas. But since this is delivered mostly through online, so even the remote areas, those in the remote areas in Indonesia, particularly even in the Papua region, Puncak Jaya, they're among the one that who can access the programs. So we saw that yes, technology is perhaps like we can use technology, but I agree that I think it's not necessary. It's not because that there is issue of the internet. So we try to avoid the technology, but how to make the technology actually more accessible first to most of the population, and then I think with that we can make sure that the benefit of technology can be enjoyed by the most of the population.
And I just want to add to this that there's no single best practice anyway. Best practice for one country could be the worst for another country. So there's no single answer to this question. And I just think we can all agree that the focus of all governments here on should be inclusivity. So any step that we take, we need to make sure that this is being advantageous for all populations within that country.
Okay, thank you. Please. Yeah.
I think we haven't talked about the role of public services. That is very critical in reducing both poverty and inequality. So the previous research book that we produced talked about the public services. So that includes the education. Most of the poor children go into the public schools. They can't afford the private schools. Most of the poor people go to the public health facilities. So investing more in public education, public health, water and sanitation, and the care infrastructure that can reduce the unpaid care work burden. Care infrastructure or services include child care centers. That could include cheap energy sources. That could also include a technology that reduces the woman's work at the home. So, and that investment private sector won't do. That always has to come from public sector. So there is a very critical role. If you look the post-World War II, all the European countries invested heavily in public education, public health. Is still the European model. Public health is almost free in majority of the European countries. So I think these are the critical future interventions to have a more investment in public services.
Is there any question? Please. Apakah ada mic di sebelah? Di sini, Mbak.
Yeah, thank you for the presentation. I am Ainul Julam from 10P2K. I want to go back to what Prof. Arif has mentioned about technology being one of the key structural factors in mitigating the future risk of inequality. Now, in the case of Indonesia, we know that it's challenging to ensure the meaningful participation of women, vulnerable communities, and those living in remote areas in socioeconomic and political participation, even before the pandemic. Now, with the pandemic, it's even more challenging, exacerbated the problem. Ms. Aruj, sorry if I forgot your name, mentioned about the digital divide too. So given the expensive digital infrastructure, perhaps Prof. Arif can share if you've seen any examples of how public and private can contribute, can work together on this, and also from Professor Gu, from a more advanced economy, we know that Korea is really advanced in technology. So to tackle that, I guess it's about the digital divide and what can we do to tackle it. Thank you.
Prof. Arif, please. Well, maybe a little bit correction first. Actually, what I said is that technology is a structural factor that we challenge, that mostly challenge the inequality. Actually, but of course, yeah, you have a point too, because there can only be
helpful, yeah, to address that. But inherently there is the digital divide. So if the question is there any examples, I think for technology, I think I don't see. You can see, for example, in Indonesia, the most of the population actually on mobile phone. So both private, and this is privately provided, right? Not, it's a privately provided. So if you are a Chicago School of Economics, you will always believe that, look, who's helping the poor in the remote area? The private sectors. So I think so. But if you see the iPhone here, for example, and you dig down what the technology behind it, majority of it is the technology produced by research by public sector. So if you want example, this is examples of how public and private sector actually, maybe unintentionally, yeah, for some reasons, actually end up with something good of technology that can benefit everyone. So, but I'm not so sure if it's formalized. Maybe, I don't know if it's formalized, perhaps it doesn't work. So it's natural, I think. Thank you.
Yeah, I think the most important one is extensive public investment in the digital infrastructure. I think around the early 2000s, the government expanded public investment in that area, and I guess almost all the areas across the nation, we have access to the internet, broadband, and so the main barrier was eliminated at that time, I guess. But the next problem was still the cost problem. So poor families and children don't have enough financial resources to spend on that area. So the government has been trying to expand some support for that area on the poor families. And also the government to try to control all the price levels imposed by the private businesses. So government a little bit control the prices. That's the next option. But if you see the movie Parasite, yeah, the families don't pay the expenses for the internet access, so they try to use the services at the near house. So there is still a problem there. So I think the next option is just trying to broaden the public spaces which provide all the internet services and computers to the especially children. Then maybe a role of the schools and a role of the public libraries and other public service offices. But unfortunately, during the pandemic, they closed all the facilities. That's a problem. That's, I think, a choice problem, political choice problem. If we do right choice, we can solve the problem, I think. Thank you.
Thank you, Professor. From other speakers, you would like to respond related to this? Aroj, you want?
I already addressed the
Okay.
digital divide issue, so I'm not sure if I can add anything more to it. I would just like to say that in Pakistan, the most commonly used digital device is television. So if some sort of a program is launched on television, it is accessible to most of the population in Pakistan. But then the problem would remain that how do you assess the children that are actually taking those classes? So every solution comes with its own set of problems. I guess the most solid thing that a policymaker can do at the moment is to redirect some of the non-development funds into developing schools and training centers and more computer labs that are accessible to the general population.
Okay, thank you, Pak Ellen. Udah. Okay, thank you. Actually, also the time is already over. So I think from what we discussed today, I think it's really interesting, and what we learned also that from the asking from the question and also answered by the speaker, that actually there is nothing fits. There is no solution fits all. That I think the important thing that we should learn from this, and probably that is appropriate or not appropriate for the certain circumstances or the certain country. So thank you so much for all of the speaker. This is really insightful. Thank you so much. And now the time for the organizer, please.
Thank you so much. Give a big applause to our speakers and also cheer from the second plenary session. What a really inspirative and insightful session. As usual, next to the speaker and chairs, before leaving the stage, we please you to stay, because next we still have the session of placard and souvenir handover, who will be given by Professor Dr. Zuziana SSI MSI as Director of SDG Center University, Padjajaran. To Professor Dr. Zuzi, we invite you to join to the stage. And next, we also would like to invite Mr. Mustafa Talpur from Oxfam International as our representative for the participation. All right. First placard session will be given to Professor In-ho Koo from South Korea. Once again, thank you so much, Professor In-ho Koo, for your participation. Photo session first. All right. And next, second placard will be given to Miss Aruj Wahidar from Pakistan. Thank you so much, Miss Aruj. All right, and the third placard session will be given to Professor Arif Ansor Yusuf from Padjajaran University, Indonesia. And also the next is not to forget to Mr. Mustafa Talpur from Oxfam International. All right. Yeah, thank you so much. And next to our chairs, of course, from this second plenary session, to Mr. Setio Budiantoro. Once again, thank you so much, Mr. Budi, for your participation. And next is, of course, our discussion from the second plenary session to Dr. Ellen Satriawan. Yeah, thank you so much. My big gift will remind you of this lovely occasion, and of course to Indonesia. Thank you so much. To ladies and gentlemen, you may return to your seat. Yeah, ladies and gentlemen, we're almost reaching the end of today's event. But before closing today's event, I would like to invite Dr. Yanuar Nugroho, PhD, as the expert coordinator of SDGs National Secretariat, to share his closing remarks with us. Ladies and gentlemen, let's give a round of applause for Dr. Yanuar Nugroho, PhD. Dr. Yanuar, the stage is yours.
Thank you very much. If I may, I'd prefer to stand up here rather than in the podium. Very good afternoon, ladies and gentlemen, distinguished guests, friends, colleagues. If I may mention, Prof. Susi, Prof. Talpur, and all the speakers in the previous session, Professor Koo, Ms. Aruj, and also, of course, my friend, Prof. Ansori Yusuf and Pak Elan. If we look at the history, after Black Death in 1300, among the great pandemics in the world, after Black Death, we saw the end of serfdom the end of slavery. So there's an improved understanding and awareness about the workers' rights. We also saw the acceleration of Renaissance from the Dark Middle Age. It was after Black Death. Then after Spanish flu in 1918, 1919, we saw the progress of modern medicine. We saw the start of understanding of the importance of global coordination in terms of policy, institutions. The question is now, after COVID-19, what do we learn? Where this all lead us to? And I think many lessons learned, this book included. I think we have learned lots of things. I think this book managed to capture perhaps one factor or one aspect of it, which is inequality. But certainly there are many other aspects that we can learn. The pandemic has brought us a new way, not only in thinking, but also in our daily life, even understanding who we really are, not only as a person, but also as a community, as country, even as region. So, if I try to recall the session today, I'm sorry I cannot join you from the beginning, from the morning, but I believe this day, I hope it's not too tiring for you. But I read through the program and I managed to join you in the last session. I think at least one aspect that we try to dig deeper here is about not just inequality as a concept, but actually the consequences to development of Robert. I asked Prof. Susi whether the discussion about, for example, financing for development has been brought up. Let me just give you one quote, for example, that globally, the gap for financing for development before COVID, it was 2.5 trillion US dollar globally. And after COVID, it increased to 4.2 trillion US dollar. And a quarter of it, 1 trillion US dollar, is what is needed by Indonesia to achieve development up to 2030. This is just an example. Because what we learned from COVID, I happened to work together with Pak Elan in the program called CARES, COVID Active Response at the time. And we managed to learn quite many things that you already shared, like the importance of, or for example, not just the importance, but how we understand now adaptive social protection, how counter-cyclical fiscal policy is important, how we can be more, I don't know the right words in English, but we should be more confident in using evidence and data for our policy. I was part of the government. I use the word was because I was in the government as a policy maker, part of policy maker. At the moment, I'm part of the government, but as the professional working in the SDG Secretariat. But the government of Indonesia was in the past, when COVID hit in the earlier stage, was even accused to be anti-science. There was a period of that, although it's quite brief period, when the government was accused to be not using evidence in the policy. But I think everyone learns. I could see gradually how the government learned, because COVID was new to all of us, right? So the question is, I think from what we discussed today, what have we been learning that we can bring forward? And I think without coming to that end, then this event today will just remain as an event rather than something more meaningful. I think we have all here get the opportunity to learn from each other. This book is included. I have not read all of them, Professor Thakur, but I managed to just skim a few chapters. And I think this book is quite interesting as a contribution to knowledge, of course, because knowledge is produced everywhere by many actors in the society today. But I think what we have here is an opportunity for all of us now to understand better where we are. COVID is a wake-up call for, I would say, all actors in the society, for government, for civil society, for business, for civil society organizations, for communities, for media, for business, you name it. COVID is a wake-up call. Everyone is forced even to see to themselves, right? To understand better where we are. But also, now it gives us also opportunity to know where we are going, where we want to go. Indonesia has this vision. In 2045, Indonesia wants to be among the top 4 or top 5 economy in the world. That is the aim. That is the aspiration. I would say this is the dream of Indonesia. How can we go there after COVID? Can we be back to our trajectory to achieve that? Is that goal or that dream compromised? And I believe from countries where you come from Pakistan, from Korea, from India, from many other countries, you also know, and all of us even, we also know where we want to go. That's the second thing. And the third thing, which is quite, and I would say very important from our discussion, especially in the last session, is how to go there. Policy options is about how. Policy options is about the extent to which we use our energy, the extent to which we use resources that we have to go where we want, from where we are. So I think with this kind of understanding, I come from Office of the SDG Secretariat from the Ministry of National Development Planning. In SDGs, we have this motto, leaving no one behind. But that kind of motto needs to be operationalized, right? I remember what you mentioned earlier. If we talk about inequality here, in the other end, that is inclusivity, right? It is not about exclusivity, but about inequality because there is gap. But in the end, if we manage to address inequality, what we want to achieve is inclusiveness, inclusivity, that what we achieve, that what we develop is for the betterment of the lives of everyone, leaving no one behind. So I hope this short remarks, well, I don't know the word, but assist you, helps you in getting some reflections from today's event. I was asked by Prof. Susi to officially conclude this gathering, this meeting, this conference. This morning you met my boss, Ibu Vivi. Ibu Vivi from Ministry of National Planning. She gave remarks. I think she presented with you lots of numbers. I read her speech. And I think shall I do the same? No, I decided not. So I left all my notes and I just came to you, delivered what I just said to you as a friend, as someone. I'm an academic, by the way, Prof. And I was called back home to join the government. And I know the tension that is lived by all academics working in the government. You know what you should do, but sometimes the government policies tell you otherwise, right? But I think here now we realize the importance of knowledge, the importance of evidence, the importance of this kind of intellectual exchange in improving our policy. So with that, I wish you all the best in your endeavors in the betterment of policy, advancement of knowledge, and herewith officially I conclude this conference. Thank you very much.
Thank you very much. Give a big applause to Dr. Yanwar Nugroho, PhD, for the warmest closing remarks. You may return to your seat. Distinguished guests, ladies and gentlemen, what a really inspiring and productive session that we've had today. We have learned a lot about the dynamics of the inequality that still persists today. And apart from the fact that we are almost entering the year of 2023, I believe our homework in tackling inequality and eradicating poverty still needs some work to do, and we can only do this together. Unfortunately, Mr. Yanuar's speech has remarked the end of today's conference. Thank you so much, everyone, for your participation and tremendous enthusiasm in this discussion. On behalf of the community, we would like to say thank you very much for joining us today and apologize if there are any shortcomings during today's event. I am Yamita Bunga, SEO's Master of Ceremony. Signing out, stay safe, everyone. Thank you and see you around. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Kalorinya berapa nih? Ini dibaca dulu kalorinya. Mau minum itu mau baca dulu kalorinya berapa? Kalorinya berapa? Rusak semua dia. Ada yang sepeda-sepedahan mau kurus enggak? Makanan lagi mana? Makanan. Oh, Pak, saya dari sepeda. Oh, makan apa? Minister sama siapa?
Please find the evaluation form in this link. Before leaving the room, to all participants, please fill the link evaluation that you can see on the screen at bit.ly/SDG-10 evaluation. Thank you so much.
Mau kemana ini? Mau kemana? Jalan. Atau area-area yang bisa ini? Mau ke Halim. Ke Halim, balik. Aku harus ke itu tuh, 4 menit, 4:30. Di Menteng. Apa?